What distinguishes Broadcasting Scotland from a website or blog, apart from our brilliant programmes?
Hi there, I'm Gordon Ross.
Are the costs we face to enable us to produce those programmes. These costs are significant and ongoing. However, our facilities are able to do so much more if only we had the staff. In the last year, some of our supporters have cancelled their subscriptions. In one way, we would prefer it if it was because they didn't like us, rather than it being because of the financial pressures which we are all under because of COVID. The really positive outcome of our fundraiser is that at a time of economic challenge in Scotland, we will use your donations to create jobs and in a small way contribute to improving the Scottish economy. If you want us to be Scotland's independent broadcaster, able to provide an alternative mainstream television platform, then please support us.
Scotland is going to be an independent country.
Just imagine what we could do if we had even 1% of the BBC Scotland channel's budget. Imagine. And then please consider turning your imagination into reality. Please support us if you can afford it.
Good afternoon. Can I remind members of the COVID-related measures that are in place and that face coverings should be worn when moving around the Chamber and across the Holyrood campus? The first item of business this afternoon is time for reflection. Our time for reflection leader today is Canon Gerard Tartaglia, our Holy Redeemers and St Margaret's Church, White Crook, Clydebank.
Presiding Officer, members of the Scottish Parliament and all who contribute here by your presence and action, it is a pleasure for me to be able to spend these few moments in reflection with you before you get down to your business. It's never a wasted thing reflecting. So much of our life is lived at top speed, racing around, in demand and doing what is wanted of us. We badly need to back off a little and confront ourselves and why we think the way we do and live the way we do. All of us were younger once. Even the youngest contributor to the life of our beloved Parliament was younger once. I want to take a little time to reflect on the young people of Scotland. I know from my own life in Clydebank, in the parish, from our youth groups and young adult groups, the tremendous gifts and qualities young people have and exhibit. There is a huge compassionate heart in so many of our young people and a deep desire to know why they are here, what their lives might mean. This is no surprise. They reflect how they have been made with the generous heart of a compassionate God. Our job is to guide and encourage those younger, to be a good example, to be coherent, and in this place in particular, to offer consistent, stable government so that they can explore themselves, their communities, their society, their faith, and the world. You may not have considered this before, but Jesus, the teacher, the rabbi, the Son of God, was in his 30s when he began his ministry. But his disciples, his followers, his students, Peter and Andrew, James and John, Mary Magdalene, Martha, Lazarus, all the others, they were not the same age or the old men and women of statues and stories. They would probably have been younger, 17, 21, 25. They grew to be brave and determined, searching and desiring to discover what their calling, their purpose might be. Our young people are in the same boat. They need to be encouraged and supported by those older with a real heart and love for them. Lord God, help us to be people who, through genuine self-reflection and by our good example, inspire our young people to greater things, to know themselves better, and to come to a mature understanding of what they are called to be and live it to the full with real joy. Amen.
Thank you, Canon Tartaglia. The next item of business is consideration of Business Motion 2544 in the name of George Adam on behalf of the Parliamentary Bureau on changes to today's business. Any member who wishes to speak against the motion should press their request to speak button now. I call Alex Cole-Hamilton. No?
That was an
Thank you. I will not call Mr Cole-Hamilton, but I will call on the Minister, George Adam, to move the motion.
Move, Presiding Officer.
Thank you. No member has asked to speak against the motion. Therefore, the question is that motion 2544 be agreed. Are we all agreed? Yes. The motion is therefore agreed. The next item of business is a statement by Nicola Sturgeon on COVID-19 updates. The First Minister will take questions at the end of her statement, and so there should be no interventions or interruptions. And I call on Nicola Sturgeon. First Minister.
Thank you, Presiding Officer. I will give a general update on COVID today and share the latest information we have on the Omicron variant. I'll also set out the further protective measures we consider necessary to help slow its spread while we accelerate the pace of booster vaccines. Firstly, though, today's overall statistics: 3,177 positive cases were reported yesterday, 11.3% of all tests carried out. The number of PCR tests yesterday was actually slightly lower than in recent days, and I therefore want to take this opportunity to appeal to people not to put off going for a PCR test if you have symptoms or a positive lateral flow test. I know no one wants to test positive or isolate at Christmas, but testing is a really vital part of our defence and there is no shortage of capacity, so please do get tested. 541 people are currently in hospital with COVID, 20 fewer than yesterday, but I can also confirm that we now know of 2 confirmed Omicron cases who are in hospital. Sequencing of other possible cases continues and the actual total is likely to be higher. 38 people are in intensive care with COVID generally, which is 1 fewer than yesterday. And sadly, a further 6 deaths have been reported, taking the total number of deaths under the daily definition to 9,725. And I want again to send my condolences to everyone who has lost a loved one. On Omicron specifically, our current assessment is that it is spreading very rapidly in Scotland. The best indicator of this is the proportion of cases showing what is called the S gene dropout. For about 95% of all cases in Scotland, tests are currently processed in a way that allows us to know if the S gene is present or not. This shows that Omicron cases are increasing exponentially, faster than any variant that has gone before it. When I made a statement to Parliament this time last week, around 4% of cases showed this S gene dropout. By Wednesday, that was 7%. On Friday, it was above 15%. Today, it is 27.5%. We estimate that the doubling time is 2 to 3 days, more rapid than anything experienced in the pandemic so far. And we expect Omicron to become the dominant strain circulating in Scotland within days. Now, this matters because Omicron is significantly more transmissible than Delta. The R number associated with Delta is around 1, but the R number for Omicron appears to be well over 2, and it is possibly above 4. Cases in Scotland in total have increased by a quarter in the past week. They have risen in all age groups except the over 85s, and Omicron is already contributing to that increase. But as it becomes the dominant strain, its much higher R number will also dominate, and that will drive a much steeper increase in cases. That is why I warned on Friday that we are facing a likely tsunami of cases in the weeks ahead. Now, some are suggesting that Omicron may be milder in its impact on individual health than Delta, and obviously we all hope that is the case. However, we don't yet know that that is the case. Indeed, there is some initial evidence from Denmark that may suggest otherwise. But even if it does prove to be milder, simple arithmetic means the challenge it poses will still be very significant. And let me illustrate that. In recent months, the proportion of Delta cases needing hospital care has been around 2%. That means an average daily case number of around 2,700, as has been the case in recent weeks, will result in around 400 hospital admissions a week. But if cases rise significantly to, say, 10,000 a day because of Omicron's much greater transmissibility, and this is well within the modelled estimates in the evidence paper we published on Friday, then even if the hospitalisation rate turned out to be half that of Delta's at just 1%, we would see 700 hospital admissions a week. So the basic and very hard fact is this: a much more transmissible infection, even if milder in terms of severe illness, can still place a much bigger burden on the National Health Service. More people infected will result in more severe illness, and tragically, more people will die. A surging level of infection will also result in many more people being off work due to mild illness and isolation. So the impact on our economy and on our ability to deliver critical services will also be severe. Indeed, we are starting to see these impacts already. All of this explains why we must take Omicron extremely seriously. This is not a choice between protecting health and protecting the economy. So let me turn to what, in the Government's judgment, we need to do now to mitigate this challenge. In doing so, I ask everyone again to think in terms of a race between the virus and the vaccines. Our vaccination programme is running fast. We are currently the most vaccinated part of the UK. 46% of the over 12 population have had booster jags already. However, just as vaccines started to win this race, the virus learned to run faster. That means we must deliver boosters even faster. And this is all the more important in light of early data telling us that the protection we have against Omicron infection with just 1 or 2 doses is significantly lower than it is for Delta. We need a booster jag to ensure a substantial level of protection against Omicron infection. So we are taking steps now to get boosters into arms much faster. Getting fully vaccinated is the best thing any of us can do to protect ourselves, our loved ones and the country. So please book your booster jag as soon as possible. Speeding up vaccination is essential, and I want to assure the nation today that it is the Government's top priority. I will shortly set out more detail on exactly how we are going about doing that. But while this is necessary, our judgment is that in the short term it will not be sufficient. While we are speeding up vaccination, we must also try to slow down Omicron. That is why we are also proposing today, albeit very reluctantly, some further protective measures. I'm appealing to everyone to follow today's advice to help slow Omicron down while more of us do get our boosters. And let me be clear, we do not do this lightly. I know how hard it is. Please believe me when I say I would not be asking for yet more sacrifice if I did not genuinely consider this to be necessary in the face of a threat that is very real. So let me set out now what is being asked. Firstly, we want to keep businesses open, but to help achieve this, we are asking them to step up the protections in place in their premises. We intend to amend regulations to put a legal requirement on those running businesses or providing services to take measures which are reasonably practicable to minimise the risk of transmission. We will issue guidance this week to make clear what that means for different sectors. For example, in retail, it will involve a return to the kind of protections in place at the start of the pandemic, for example, measures to avoid crowding and bottlenecks. This will include physical distancing, measures to control the flow of customers and protective screens. For hospitality, it will mean, for example, measures to avoid crowding at bars and between tables, and a reminder of the requirement to collect contact details of customers to help with contact tracing. For employers more generally, the guidance will make clear that enabling staff who were working from home at the start of the pandemic to do so again is now a legal duty. I'm hugely grateful to employers who are already allowing staff to work at home where possible, but we are not yet maximising the impact of home working to reduce the overall number of contacts we are having. We recognise, of course, that there are people who cannot work from home, for example, those who work in manufacturing, hospitality and key public services. We're asking anyone in this position to test regularly before going to work. We have extended the workplace testing scheme, which delivers lateral flow kits twice a week to all businesses who have signed up to it. I would urge indeed any business with 10 or more employees to join up and encourage staff to test regularly. We will also be reinforcing the rules and public health messaging on the importance of wearing face coverings and wearing face coverings properly. Presiding Officer, my hardest request today is of the general public. I want to be clear, I am not asking anyone to cancel Christmas, but in the run-up to and in the immediate aftermath of Christmas, I am asking everyone to reduce as far as possible and to a minimum the contacts we have with people in other households, and I will say more about Christmas Day in a moment. We are not banning or restricting household mixing in law as before. We understand the negative impact this has on mental health and well-being. But we are asking everyone, and we will issue strong guidance to this effect, to cut down as far as possible the number of people outside our own households that we are interacting with just now. This will help break transmission chains. So my key request today is this: before and immediately after Christmas, please minimise your social mixing with other households as much as you can. However, if you do plan on socialising, either at home or in indoor public places, we are asking that you limit the number of households represented in your group to a maximum of 3 and make sure you test before you go. I know this is a tough thing to ask people to do, especially at this time of year. So I want to be clear why we are making this request. One of the things we have already learned about Omicron is that it has a very high attack rate. This means that if just one person in a gathering is infectious, that person is likely to infect many more people in the group than is the case with the Delta variant. So by reducing the numbers of people in households gathering together, we help limit the extent of its spread. Turning to Christmas Day specifically, or Christmas Eve or Boxing Day, or whenever you have your main family celebration, we are not asking you to cancel or change your plans, and we are not proposing limits on the size of household gatherings. Places of worship will also remain open with appropriate mitigations. But we will issue guidance to help you make Christmas safer. Reducing your contacts in advance of and after Christmas, as I have just strongly advised, will help do this. Keeping your celebrations as small as your family circumstances allow is sensible too. Make sure everyone in your gathering is vaccinated and has done a test in advance. Keep rooms ventilated and follow strict hygiene rules. Presiding Officer, I know how much I am asking of everyone today after a difficult and painful 2 years. I would not be doing so if I did not believe it to be absolutely necessary. Indeed, it could be argued that we should be going further, which is why I need to also explain a significant limitation on our ability to act in the way we think necessary to protect public health. And in this context, I am genuinely not seeking to make a political point, simply to set out the factual position. Many of the protections that help curtail COVID come at a financial cost to individuals and businesses. So wherever we can, we put in place financial packages to protect people's health, jobs and livelihoods. However, the Scottish, Welsh and Northern Ireland governments do not have the ability to borrow to meet the COVID funding challenge. UK funding arrangements mean we rely on the Treasury to do so on our behalf, and the Treasury has responded well throughout this pandemic. And although Scottish taxpayers foot our share of the bill, money only flows to the devolved governments when the UK government makes decisions. Financial support is not triggered if the devolved governments take decisions we consider appropriate for public health reasons, even though it is our responsibility to do so. So because the UK Government is at this stage not proposing any further protections, a position I do not agree with, there is no funding generated to compensate businesses for any protections we think are necessary and wish to put in place. That is not acceptable in current circumstances, and with the Welsh and Northern Irish governments, we are pressing for a fairer approach that takes account of our devolved responsibilities for protecting public health. But for now, this is the situation we are in, and it means our public health response is curtailed by lack of finance. There are further steps we could and would have considered today, particularly around hospitality, had we the financial ability to do so, but we don't. However, I can confirm that with some considerable difficulty, we have managed to identify within our own resources around £100 million that we will use to help businesses, mainly those in hospitality and food supply and in the culture sector, affected by our advice last week on work Christmas parties and further affected by what I have said today. The Finance Secretary and her officials will be engaging with affected sectors immediately to consult on and confirm the details of support. We will work to make money available as soon as possible. Businesses who previously received support through the Strategic Business Framework Business Fund will be contacted directly. We have also identified an additional £100 million to ensure the self-isolation support grant is available for those who need it, given the expected increase in the number of eligible people who will be asked to isolate. Making this money available will involve difficult reprioritisation, but we recognise the importance of providing as much help as we possibly can. However, this is the limit of what we are able to do within our own resources. I know it does not go far enough in compensating businesses for what we are asking of them now, and of course no government can rule out having to go further in the weeks ahead. So we are continuing to press the UK Government to increase support to enable us to respond adequately to the public health challenges in the weeks ahead. Presiding Officer, I will turn now to our actions to speed up delivery of booster vaccinations. Anyone aged between 40 and 60 who hasn't already booked an appointment has now received an invitation to do so. In addition, since yesterday, all 30 to 39-year-olds have been able to book their booster jags online, and I can confirm today that 18 to 29-year-olds will be able to book online from tomorrow. Our aim is that by the 31st of December, everyone over 18 will have been able to book a booster appointment. It is not possible to guarantee that absolutely everyone over 18 will have been vaccinated by 31st December. For a variety of reasons, some appointments will run into the new year. For example, some people will not be eligible by the end of December because it will still be less than 12 weeks since their second dose. Some people have not yet come forward for a first or second dose, and despite our best efforts, some will not come forward to book a booster either. In addition, despite the strenuous work underway, we know that some capacity challenges between now and the end of the year are inevitable. For example, vaccinator staff absences due to COVID. However, notwithstanding all of that, we are aiming to reach as close as possible to 80% uptake by the end of December, with the balance of appointments taking place in January. I do not underestimate the challenge of this. Vaccination teams are already making a Herculean effort, and we are asking a great deal of them. In addition, reaching that level of uptake depends on people continuing to come forward to get JAGs, even over the holiday period. So this will not be easy, we know that, but we are working on the basis that the higher we aim, the further we will get. Let me now therefore set out the steps we are taking to create the additional capacity needed. Firstly, given its vital importance against Omicron, we will prioritise the COVID booster programme over the remainder of the flu vaccination programme for the next few weeks. This will allow many more booster appointments to be made available. Let me stress, though, and this has informed our clinical advice, that for those in the highest risk groups for flu, uptake of the vaccine this year is already high. For over 65-year-olds, it is 88%, which is higher than last year. Secondly, and in line with advice from the UK Chief Medical Officers, the requirement for people to wait in a vaccine centre for 15 minutes after they receive an mRNA vaccine is being removed. This will speed up vaccination times and enable many more appointments. Thirdly, health boards are working to offer additional drop-in capacity within local vaccination centres. Additional venues for vaccination are also being identified. This will include mass vaccination centres in areas where this is considered appropriate. In terms of human resources, we plan to extend the number and role of volunteers to ensure that clinical staff can spend as much time as possible supporting the administration of vaccines. We will continue to expand the size of the overall vaccination workforce as much as possible and make full use of any military support that is available. We will, of course, Presiding Officer, keep Parliament updated on the delivery of these plans. However, at this stage, I want to again thank everyone working so hard to design and deliver the biggest and the most important logistical project in our peacetime history. Let me also stress that while the focus of my statement today is on boosters, if you haven't had your first dose yet, please do book it now. It is more important than ever to do so. In the new year, we will also complete second doses for 12 to 17-year-olds, and I hope, very much hope, that we might also soon get regulatory approval to offer vaccination to under 12s. Presiding Officer, before I close today, there are some further issues that I want to highlight. Firstly, let me reiterate the changed advice on self-isolation. For now, household contacts of a person who tests positive for COVID are being advised to self-isolate for 10 days. This advice applies to everyone in a household, regardless of age, vaccination status or PCR test result. Businesses and organisations providing vital services can apply for an exemption to allow essential workers to return to work, subject to them being symptom-free and taking certain precautions, including daily lateral flow tests. Second, beyond this advice, we are not recommending that entire school classes are required to isolate when a pupil tests positive. The advice on school isolation will continue to be risk-based. More generally, a key aim is to ensure that schools stay open, if at all possible, to minimise further disruption to education. However, it is vital that schools are safe for pupils and for staff. To help achieve this, we continue to ask secondary school pupils and all staff to take lateral flow tests regularly, including during holidays and before returning after the break, and to wear face coverings. In addition, the advisory subgroup on education is meeting today to provide further advice on how schools can operate safely in the new year, and we will send this advice to schools by the end of this week. Thirdly, we will continue to consider appropriate protective measures for people in institutional settings, such as care homes, while ensuring that visits can continue. Last week, we recommended that care staff take lateral flow tests on a daily basis. We are also now recommending that individual visits in care homes should not involve any more than 2 households visiting any patient at a time, and we are asking anyone visiting a care home to test before every visit. For hospitals, we are recommending that no more than 2 people visit a patient at any one time, and again, we are recommending a lateral flow test before each visit. Finally, Presiding Officer, I fully understand that Omicron will be especially concerning to people on the highest risk list. I therefore want to give an assurance to all of you that the Chief Medical Officer will be writing to you shortly with further advice and assurance. Presiding Officer, it's an understatement to say this is not the update I wanted to be giving just a few days before Christmas, and I am painfully aware that it is not an update anyone wanted to hear. However, we have a duty to take decisions, no matter how difficult or unpopular, that will get us through this as safely as possible, and I will not shy away from that responsibility. The fact that I'm asking for further sacrifice today underlines how severe we think the risk posed by Omicron might be. So please do follow the advice I have set out today. And while this is without doubt a very difficult juncture in the course of the pandemic, please remember that vaccination does still put us in a better position than last year. Also, hard and very wearying though this is, we are not powerless in the face of the virus. We know the steps we can take to slow it down. So I will stress again what we need to do. Firstly, please get fully vaccinated as soon as possible. Secondly, please test regularly if you are going to meet other people, and our advice, remember, is to minimise this as much as possible. Take a lateral flow test before you go every time. The tests are easy to take, and despite an issue with online ordering yesterday, they are easy to get hold of. Tests can be collected from local pharmacies and testing centres without a booking, and the online portal is open again today. Wear face coverings on public transport, in shops and when moving about in hospitality settings, and make sure your face covering fully covers your mouth and nose. Keep windows open if meeting people indoors, even at this time of year. Follow all advice on hygiene. Work from home whenever possible. This will soon become a requirement anchored in law. And please follow the new advice I have outlined today. Although it is guidance, please do not think of it as optional. Cut down unnecessary contacts as much as possible. In the run-up to and immediately after Christmas, please avoid socialising with people in other households as much as you can. If you are socialising indoors at home or in public places, limit the number of households represented in your group to a maximum of 3 and test before you go. And please follow the advice we will give to keep Christmas Day as normal but as safe as possible. We do face an extremely difficult period again ahead. I cannot tell you otherwise. But I know we will get through it more safely if we do right by each other, as we have done all along. So please get vaccinated, test regularly and follow all of the other rules and guidance that are in place for our own protection. Let us pull together again and let's help each other through.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 70 minutes for questions, after which we'll move on to the next item of business. And I'd be grateful if members who wish to ask a question were to press the request to speak buttons now. And I call Douglas Ross.
Thank you very much, Presiding Officer. The situation with the new Omicron variant has changed the circumstances in which we are all dealing with. The Scottish and UK governments have both examined the new variant, and it's clearly more transmissible, with the potential to severely impact the NHS and other vital services. So let me reiterate the key requests to everyone. Those who can, go out and get fully vaccinated and get your booster jab as soon as possible. Take a COVID test as often as you can. Take a lateral flow test before you go to bars and restaurants, before you go to meet your family and before you go to work. And take every precaution possible to protect your family and the people around you. But the government must also live up to their end of the bargain. And the most important defence we have against this virus is the booster vaccine. The vaccine booster scheme is going well, and the volunteers and staff undoubtedly deserve our praise and thanks. But now we need to go even faster. Week after week, my party has come to this chamber and asked the First Minister to prepare to bring in mass vaccination centres. But only now, only today, has that been accepted. The Scottish Government have delayed, and now they're scrambling to find venues at the last minute. So can I ask the First Minister, why has it taken so long for the Government to accept our calls and agree to launch mass vaccination centres that were so crucial and successful in the original rollout of the vaccine? My party has also called for extra support to be made available to protect Scottish jobs and to help the businesses who are already struggling and losing income right now, as we saw over the weekend up and down Scotland. Last week, we said that businesses would be impacted at one of their busiest times of the year, and they desperately needed financial support. Yesterday, we called for an emergency cancellation compensation fund to protect jobs. So it's very welcome that these calls have been listened to and support is coming from the Scottish Government for Scottish businesses. But can I ask the First Minister to confirm that payments will reach these businesses before Christmas? And I'm sure, like me, the First Minister, who said she didn't want to make a political point, will welcome the announcement from Rishi Sunak and the UK Government that additional funding will be made available to the devolved administrations. During her briefing on Friday, the First Minister announced that from Saturday, household contacts with a positive case of any variant had to self-isolate for a full 10 days, meaning a single positive case would lead to a household of potentially 4 or 5 people having to isolate for that entire 10-day period, even if they tested negative. Now, we agreed for the need for caution, but at the level of cases that the Government is expecting by next week, this rule change could mean tens of thousands of Scots put into self-isolation every single day. We don't believe this policy is sustainable. It will have knock-on consequences that could impact our transport services, police, schools, workplaces across the country, even our vaccination programme. So can I ask the First Minister to outline the science and data behind the change in policy which she announced last week, and what impact the Scottish Government modelling says it will have on our economy and public services? Now, clearly we've had today a change from the announcement on Friday, and the First Minister is now saying, and I quote, "Businesses and organisations providing vital services can apply for an exemption to allow essential workers to return to work." So finally, can I ask the First Minister, how is that going to work? Where will organisations apply to for an exemption? What criteria will the exemptions be judged on, and how quick will the turnaround be in the applications once they're made?
First Minister.
Let me take that last point because it's probably the easiest one to deal with, as anybody who had been paying attention to this over the last few months would have known. We had an exemption scheme in place before, so the arrangements for the parts of the economy who can apply for that, the arrangements to apply and who they apply to are the same as before. We'll make sure that that information is refreshed. On the other points, let me take them as fully but as quickly as I can. On vaccination, our vaccination programme is currently the fastest in the UK. We have designed it carefully so that the right facilities are available in different areas. Mass vaccination centres are not appropriate in every area. Often they result in very high do not attend rates, and that means we have appointments that are lost on a daily basis to the system. So we flex the system to make sure we are being appropriate to the characteristics of different areas. There are a number of health boards who already have drop-in clinics, but as we try to accelerate this programme, we look again at the additional things we need to do. It will still not be the best use of resources to have mass clinics in every part of the country, but in some areas, perhaps here in the city of Edinburgh, in Glasgow, for example, that will add helpful capacity to what is already there. So we will continue to do this in the best way possible. And what I would say to people, not in any way to strike a note of complacency, because that is the last thing we are around this, is that what we have been doing so far in this vaccination programme has resulted in that fastest progress of any of the UK nations. So that doesn't mean we'll continue with that, we will have to work at that, but it does, I hope, give some degree of confidence that the right judgments are being taken in how we proceed with this programme. But it is now more important than ever, and as I said in my statement, it is absolutely the top priority for the government in the days and weeks ahead. On the issue of money, I've just been passed a note. I didn't have this information because I don't think it was announced before I came in, that the UK Government have announced that there will be additional funding made available to devolved administrations. I don't have any of the detail of that yet, but I do absolutely welcome that. I think that is very good progress. It's a move we have been pushing for the last number of days. We have gone out of our way, rightly so, to find as much additional resource within our budgets as we can. I noticed the Tory spokesperson calling for a fund of £10 million last night on television. Today we've announced £100 million for businesses, and obviously we'll look at the impact of the UK funding when we have the detail of that. In terms of the isolation policy, the clinical advice right now is, because of the faster transmissibility of this, releasing people from isolation within a household when they test negative is not as safe as it could be, because testing negative one day with this virus doesn't mean you will test negative the next day. That is the basis of this advice. But we are keeping this under review. We have already started looking at when we might migrate away from that towards something that is more proportionate, because I absolutely understand, indeed I've set it out myself, the impact that isolation may have on the economy. So this is about taking appropriate steps now, but being flexible as we think it is safe to do so, to move to more proportionate arrangements in the future.
Thank you. I call Anna Sarwar.
Thank you, Presiding Officer. I want to start by sending my condolences to all those that have lost a loved one. The rapid spread of the Omicron variant is a real cause for concern, and we must be prepared as a Parliament to take the right decisions in the national interest. We may not yet know just how dangerous this new variant is, but what we do know is that this virus risks lives. I know how hard this must be for families across Scotland after almost 2 years of the pandemic, but we cannot let our guard slip or let our resolve weaken at this crucial moment. We all have a duty to protect each other and do what is in the best interests of our country and our NHS. So can I urge the people of Scotland, do your duty. If you are eligible for a first or second dose but have not yet had it, please book that appointment now. For those eligible for a booster appointment, book it as soon as you can. As Christmas approaches, we all want to protect every precious moment we may be able to spend with our loved ones. That means working from home where you can, wearing a mask where appropriate, and taking lateral flow tests before going to social events or visiting each other at home. It is also important that in taking any decisions, we take people with us. That means sharing as much information as possible, the data and the science. Hospitality is one of the hardest hit sectors through this pandemic. Christmas is a time when many of these businesses would have been hoping to catch up on lost earnings in order to survive. They will need extra support. I welcome the assistance outlined, but can I urge the Scottish Government to please engage with these businesses and deliver this timely support they need. I also note what the First Minister said about wider support packages. So if that means the UK and the Scottish Government working together to find a package, then that is what needs to be done in the national interest. A few specific questions. All over 18s are to be offered a COVID booster appointment by the end of the year, with a target of 80% receiving it by the end of the year. That is only 18 days away. That means over 75,000 vaccines a day. I welcome there are plans for mass and drop-in vaccination centres. How quickly do we think those will be operational, and will there be military assistance? Given there will be higher demand, is the First Minister confident that we have an adequate supply of lateral flow tests, and what steps are being taken to make them more easily accessible to people across the country? And no one should have to think of the financial impact of self-isolation on them or their family. So I note the additional money, I welcome it, but what considerations have been made to increase the eligibility and the amounts available to individuals who need them? Finally, again to the people of Scotland, stay safe, follow the advice, we will get through this.
First Minister.
Thank you for those questions. Can I just say, firstly, on hospitality, I don't think I addressed the point that was raised in the previous round about will this money be delivered before Christmas. We will do our best to make sure this money, or as much of it as possible, is delivered as quickly as possible and hopefully before Christmas. I absolutely agree that hospitality has had a sucker punch in the last couple of weeks because of the inescapable, unavoidable public health advice. We know that Omicron is spreading fast generally, but the high attack rate means that if there is a group of people at a Christmas party, for example, if one person has it, almost all are liable to be infected. That is the higher attack rate that has made this advice unavoidable. On the issues with the COVID booster, the additional capacity will start to become available over the next few days and over the course of this week in the form of extra centres and, where necessary and appropriate, mass vaccination centres and additional appointments at existing centres. We will make maximum use of the military. There has been UK Government commitments to make more military support available. Let me stress, though, that the biggest increase in capacity that will be delivered and will be delivered most quickly are the changes I talked about to prioritising COVID boosters over flu vaccination. That will free up significant numbers of appointments, and also removing, on clinical advice, and the 4 UK Chief Medical Officers have given the go-ahead to this, removing the requirement for people to wait in vaccination centres for 15 minutes. So actually these two things will make the biggest immediate impact on increasing the capacity to do more booster vaccinations. And I'm absolutely well aware of the run rate that we have to get to meet the targets we've set today, although these targets also depend on people coming forward. We know that both supply and demand in a normal year for an immunisation programme would dip over Christmas, so we need to work to keep that as high as possible. Lastly, in terms of the self-isolation support grant,
Alex Cole-Hamilton.
Thank you very much, Presiding Officer. Nobody wants to surrender the progress that we have all made over the last 18 months. But at moments like this, at times of crisis, we need clarity from the government. We need businesses to get support, pound for pound, and we need both the Scottish and UK governments to work together. People will struggle to understand why it is safe to mix with 400 people at a concert, but not 4 families in their own home. The effect of this public uncertainty will see the event sector rocked and events cancelled. I want to bring a particular situation to the First Minister's attention. It concerns the event sector and our efforts to ramp up the booster programme. A rave of 3,500 people taking place this Saturday is set to displace the principal vaccination hub for NHS Lothian at the Royal Highland Showground. This will reduce vaccine capacity at that venue by 50% until after Christmas. As of 2 p.m, RHS had heard nothing from the Scottish Government, and without clarity, they are contractually obliged to begin dismantling the vaccine operation this evening. This is really urgent. So can I ask the First Minister, what should they do?
First Minister.
I first spoke to the Health Secretary about this first thing this morning. I can't remember at what time. Action is underway to cancel the rave, to make sure there's full compensation for that, and make sure that the vaccination centre in its current location continues. The Health Secretary has been working on this all morning. I'm sure he will be happy to give an update when we're out of the chamber. But it is something that was planned pre-Omicron, but clearly, in light of the Omicron developments, is no longer appropriate, because we want to increase the facility facilities for vaccination, not see them go in the opposite direction.
I call Kokab Stewart to be followed by Sandesh Gulhani.
Thank you, Presiding Officer. I would like to ask the Scottish Government what advice it would give to parents who are concerned in relation to the Omicron variant and are considering keeping their children off school.
First Minister.
I would encourage parents to continue to send their children to school. I absolutely understand the anxiety parents will have at this time. It's important that Test and Protect with local health protection teams work on a risk-based and targeted way to ensure that where there are cases identified, the right approach has been taken to advice for self-isolation. There are also other mitigations in place in schools, particularly in secondary schools, around face covering and the requirement to take lateral flow tests regularly. I know these mitigations have been controversial in the past, but they are really important. As I said in my statement, the Education Advisory Subgroup is meeting today to look at additional measures that we may advise schools to put in place for the new term. I'm not going to preempt what these recommendations will be, but I suspect they will include further advice on ventilation, for example, because we know how important that is. And as I said earlier on, we will ensure that that advice is with schools by the end of this week. So I completely understand the anxiety, but I know that parents will also be anxious about the disruption to children's education, and we want to work in a way that minimises that as far as possible during this next difficult phase.
Sandesh Gulhani to be followed by Bob Doris.
Thank you, Presiding Officer. I listened with some concerns about the Omicron variant and want to reiterate the importance of getting vaccinated all the way to your booster jab. It's not too late. First Minister, a month ago, I asked to reopen mass vaccination centres with local flexibility using volunteer support. And if you'd listened to me then, we'd be well on our way by now. But I welcome the Scottish Government's listening now. And it's great the First Minister listened to me on telly last night and found money for businesses that was much needed. I also asked to instigate mobile vaccination centres to help those 70 areas of Scotland where only 40% of the population 40% of the population require the second dose, and help our remote communities as well. I made these suggestions to help the people of Scotland. In addition to the measures you've announced today, will you now commit to mobile vaccination centres to help those hard-to-reach people get the jab into their arms as quickly as possible?
First Minister.
We already have mobile vaccination units, and there are plenty of clinics operating within more rural areas. What we need to do now is expand the capacity in those to make sure that they can do more appointments and, where necessary, open additional facilities. And as I've said, we will do all of that. Not every area, mass vaccination clinics are not appropriate for every area. That is not the best way to get everybody vaccinated. The appointment system is important, but we will continue to flex this. I absolutely take on board every suggestion that is made, but I do think we should reflect on the fact that, as I keep saying, because it is important, that obviously what we have been doing up until now has been successful, because our vaccination programme is further ahead, on boosters actually, quite a bit further ahead than England, Wales and Northern Ireland. So that suggests that we're getting that balance right, but that was then, this is now, and we've got to significantly increase the pace, and therefore we look again across the whole of the provision and decide where and how we add the capacity that is needed.
Bob Doris to be followed by Jackie Bailey.
Presiding Officer, a constituent's elderly mother has advanced dementia and was admitted to hospital a few days ago. On previous admissions, NHS Greater Glasgow and Clyde permitted visiting under an essential visitor policy, which specifically mentions both dementia and end-of-life care. However, my constituent is now struggling to see his mother, something which left his mum distressed and anxious, and the family worried. Of course, I am in communication with NHS First Minister, but can I ask the First Minister, has there been any change to essential visitor guidance in the light of the Omicron variant? And if not, can the Scottish Government work with NHS boards and staff to ensure guidelines are clear, well understood and applied to ensure emotional support and end-of-life care can be offered appropriately?
First Minister.
Well, we will ensure that refreshed guidance is issued to health boards to ensure that they understand what the appropriate measures are with hospital visiting. I set out today that we absolutely do not want to stop visiting. It's really important that visiting goes ahead. It's important for people in hospital and for their loved ones, but we are suggesting a limit of the number of visitors for each patient at any one time. Visiting should continue with appropriate precautions and mitigations. Patients should not be denied visitors except in very short-term, very specific circumstances, such as managing an ongoing outbreak, where, of course, hospitals can put in place temporary visiting restrictions. However, even when managing an outbreak, we expect what we call essential visits to continue, and a person with dementia is a clear example of someone we would expect to receive essential visits even during an outbreak.
Jackie Bailey, to be followed by Christine Graham.
Care packages are being cancelled as we speak due to staff absence. I have a constituent who had carers coming in 4 times a day, and all of that support has been pulled. She has been told that this will last at least a week and to phone an emergency helpline if anything should go wrong. This puts her health at considerable risk. What can the First Minister say to those who feel abandoned as their care packages are withdrawn? What urgent support can she put in place? And can she confirm that exemptions will apply to health and social care workers from the 10-day self-isolation rules?
First Minister.
On that last question, yes, that was the case previously and that is the case now. I covered this at some length in my statement. This is part of the challenge we are facing. This virus, not just through isolation, but if it infects people and people have mild illness, they cannot go to work. That is why we need to crack down on this virus, because otherwise we are going to see these impacts in our schools, on our public transport and on the part of people who rely on care packages. Now, we will continue to work with the health service and social care to mitigate these impacts as far as possible. I absolutely understand the impact on anybody of not having their care package for a single day, let alone multiple days. But the root of this is to get this virus under control. And that is why what I've set out today is so important. And it's why it is so important that we all continue to urge the people across Scotland to do the right thing by following all of this guidance.
Christine Graham, to be followed by Gillian Mackay.
Thank you, Presiding Officer. First Minister, these Tuesday COVID statements to Parliament are of course essential for Parliament to hold the Scottish Government to account. Public engagement and compliance is key, as it has been from the very start and very high. However, constituents tell me that they miss those regular lunchtime televised COVID information updates, which were so important in the early days of the pandemic. In this fast-moving situation brought about by the Omicron variant, can these lunchtime public information broadcasts be reinstated?
First Minister.
I could hear the enthusiasm from the Conservative and Labour benches as Christine Graham was speaking. Whatever people might think, I don't miss having to do daily updates on COVID, although we don't know what lies ahead. Look, I respect Parliament. I should come to Parliament, be accountable to Parliament, make announcements to Parliament. It's not for me to decide the days on which Parliament sits. If Parliament wants to recall, that's a matter for the presiding officer. What I can't do during a public health emergency is withhold decisions or advice to the public from 5 p.m. on a Thursday evening until 2 p.m. on a Tuesday afternoon. That would literally put lives at risk. It's also sometimes important for me to be able to communicate to the public with the Chief Medical Officer and the National Clinical Director there to answer clinical questions. So I will continue to do everything I can to get key public messages across. And I think in an emergency like this, it's incumbent on all of us to try to put the differences to one side and unite to get those public health messages across.
I call Gillian Mackay to be followed by Paul McLennan.
Thank you, Presiding Officer. The Scottish Greens have advocated a cautious approach in dealing with the pandemic throughout, and that remains our position. Boosters will play an increasingly important role in providing protection against the Omicron variant, so I'd urge everyone who is eligible to book their appointment. I appreciate the further funding from the UK Government that was announced just after 2 p.m, but it would appear at the moment to fall short of furlough. A lack of furlough fundamentally limits the options available to both the Scottish Government and this Parliament to tackle the spread of the Omicron variant. Could the First Minister advise the Chamber what work is ongoing to try to obtain the financial support required if further measures are needed?
First Minister.
This is an issue we've discussed very constructively in Four Nations meetings over the course of the past week. It's an issue that has been raised as you would expect, by me, by the First Minister of Wales and the First and Deputy First Ministers of Northern Ireland. And as I say, I've not seen the detail of what the UK Government has announced. I look forward to seeing that later, and I welcome it. The basic principle here, I think, and it should apply across all parts of the UK, is that if we feel it essential to take measures to protect public health, we should not be constrained in doing so because of the financial considerations. So it should not be the case that money is only triggered if the UK Government decides to take steps. If the Scottish, Welsh or Northern Irish Government, acting within devolved responsibilities, think that is important, we should be able to trigger that support as well. It's about parity, not asking for one part of the UK to have an advantage over the other. We all pay for this, and it's important that we all have equal access to financial support for businesses and individuals whose livelihoods are on the line. I certainly think that everything should be kept open and under review, including the reinstatement of furlough over what we hope will not be, but may be, a really challenging period for businesses in the weeks to come.
Paul McLennan, to be followed by Liz Smith.
Thank you, Presiding Officer. I welcome the commitment of the Scottish Government to support the hospitality trade and indications of support from the UK Government. Given this Parliament does not have borrowing powers to fund the kind of response required, will the First Minister press the UK Government to advise this Parliament of details of their support package as soon as possible, and whether the Scottish Government has any specific asks for this funding?
First Minister.
As I said, I don't. The Deputy First Minister is telling me that the detail I've given the Chamber is the detail we have at the moment, that more money will be made available, but we don't know how much that will be, or indeed whether that is genuinely additional money, or whether it will be netted off against expected savings elsewhere. I welcome it. I welcome any movement on this, but I hope the Chamber will appreciate that I really do need to see the detail before I can comment any further on it. We want to be in a position where we can take necessary measures to protect public health without having to plead for financial support, in a situation where if the UK Government was taking these measures, they would be able to make that financial support available. It is about parity and the ability to, whether that is furlough to protect the wages of workers or to compensate hospitality businesses for the knock, the significant knock to their Christmas trade. Whatever it is, we need to be in an equal position to compensate for the necessary public health measures that we are taking. So I hope we've seen progress today, and I'll happily report back to Parliament when we've got more detail.
Liz Smith, to be followed by Gillian Martin.
Thank you. First Minister, can I ask this question on behalf of two sets of constituents who've been in touch with me in the last 24 hours, whose family have just arrived home. They're obviously working abroad, but they've arrived home for the Christmas break, and they've had in respective countries 2 vaccinations. Will they be eligible for the booster if they are British passport holders?
First Minister.
I think in principle the answer to that would be yes, but obviously there will be a caveat around that in terms of what vaccinations they have had in the countries they come from. I don't know the detail of that and whether therefore they can have the boosters here. So if Liz Smith wants to write to me or the Health Secretary with the details, I'm happy to give an answer particular to the case rather than the general answer I'm able to give on the basis of the information I have just now.
Gillian Martin, to be followed by Monica Lennon.
Thank you, Presiding Officer. The First Minister has mentioned in her statement that, of course, the new variant presents a problem in terms of the capacity for the health service. I'd like to, there'll be people watching this tonight who may be undergoing or looking for critical surgery or undergoing cancer treatment. Can I ask the First Minister what assistance has been given to health boards and what the plans are to make sure that these people get the treatment that they need? And those that are vulnerable leaving hospital, what's been done to ensure that there's care packages in place so that they can leave hospital and they're not left in hospital, they're not left in hospital blocking beds?
First Minister.
Well, these are important issues. In terms of critical care, NHS staff are obviously working extremely hard and are under intense pressure, but health boards will continue to prioritise critical patients and urgent care as much as possible, and of course in line with the clinical prioritisation framework published back in November 2020. Obviously getting patients appropriately discharged from hospital is also important. We have invested significantly to enhance care at home services, although of course the issue of staff absences is one that is a concern for us. So these matters are all being given significant attention and priority. The health and care workforce are working above and beyond the call of duty right now. We are asking them to do more in terms of accelerating the vaccination programme, which is why I think it is important, as I've set out today, that we try to free up capacity there in ways that doesn't ask them to pause other forms of care where that is avoidable. But we'll continue to do everything possible to support them during this difficult winter.
Monica Lennon, to be followed by Annabel Ewing.
Thank you, Presiding Officer. NHS Lanarkshire declared code black 53 days ago. Staff are exhausted and they fear a trickle of Omicron cases, never mind a tsunami of infection. What more will the Government do to support staff and patients in Lanarkshire, including chronic pain patients like Liz Barry, who has already waited 21 months for a steroid injection that she and many others should be getting twice a year?
First Minister.
We'll do everything we possibly can to support those working in the health service. I can't even begin to find the words to express my appreciation of, but understanding of the pressure they are working under. And obviously there are many patients, including the individual cited by Monica Lennon, who are having disruption to the care. So we'll do everything we can to mitigate these impacts, but we come back, as we so often have in this pandemic, to the hard reality at the centre of this. The impact on services is coming from the pandemic, and therefore as cases go up, then we see a bigger impact in people being off sick, having to isolate, and an inevitable impact on services. So we need to come back again, hopefully for the last time in this pandemic, although none of us know exactly what's ahead, but come back again to this need to pull together, to do all of the right things, to drive infections down again, because that will do more than anything else to allow us to get the NHS sustainably back on the path to normality.
Annabel Ewing, to be followed by Murdo Fraser.
Thank you, Presiding Officer. Whilst I can appreciate, of course, that no one has a crystal ball, given that we are now just 10 days from Christmas Eve, can the First Minister advise as to whether my Cowdenbeath constituents and indeed people across Scotland can now, in fact, reasonably start to finalise their Christmas plans, based, of course, on the series of protective measures that have been set out today?
First Minister.
Yes, I think that is a reasonable thing to say. I've tried to set out as clearly as possible today that we don't want to put limits on people's ability to gather in their families for Christmas Day, or if people celebrate on Boxing Day or Christmas Eve, whenever they choose to have that main celebration. But there are things we need to do now, reducing our contacts, avoiding socialising with other households to make that safer. There are things we need to do around testing and ventilation and hygiene on the day to make these things safer. I really want people to be able to do that, but I can't stand here and tell them that there are no risks around Omicron. One of the darkest days, I think, for many people many dark days over the course of this pandemic, and certainly one of the darkest days I experienced was on the 19th of December last year, having given people some limited normality, to have to take that away from them before Christmas. Nobody, I certainly don't want to be in that position. So let us do the things that I'm asking today around limiting contacts, limiting socialising, in order to get through Christmas with that freedom to enjoy Christmas, and then after that continue to limit socialising so that we don't see the surge in cases afterwards. That is my best advice to people right now in what is a really, really difficult situation.
Murdo Fraser, to be followed by Stephanie Callaghan.
Thank you, Officer. The financial support already announced for the hospitality and food sectors is very welcome, and hopefully there will be more coming. But losses consequent to the announcement on Thursday about Christmas parties not being recommended go far beyond this. I've been contacted by constituents in the hair and beauty sector who have suffered a whole range of cancellations of what would normally be their busiest time of year with the Christmas party season. So will there be financial assistance offered to those businesses as well?
First Minister.
The money, the £100 million pot that I have announced today is the limit of what we can do within the resources we have, and we are going to have to make really difficult choices in order to make that money available. And I'm being candid with people. Again, that is not insignificant, and I'm not I'm genuinely not trying to be political here, but the Conservative spokesperson said that 10 million was what they wanted to see. We've delivered 10 times that today, and I think that is right. But that doesn't go near full 100% compensation for the losses of business. So I hope that what is being announced by the UK Government today, I won't repeat what I've said about not knowing the detail of that, I hope that allows us to go further with compensating businesses for the losses associated with our current advice, and also gives us the flexibility, should, and I hope we don't, but should we need to go further in order to do more. So I will look at that, and if we can do more, we will, but we have, I think, rightly made available today the maximum we can do within the resources we currently have at our disposal.
Stephanie Callaghan, to be followed by Craig Hoy.
Thank you, Presiding Officer. To ask the First Minister whether further steps can be taken to encourage higher uptake of vaccines and boosters in minority ethnic communities and lower socio-economic groups.
First Minister.
Yes, I think the answer to that is yes, more can be done and more needs to be done. We're working with NHS boards who have dedicated inclusion plans within the vaccination programme, outlining how they will offer vaccination to people who often face barriers to uptake. Health boards plan location of clinics to suit the needs of their populations and often respond to evidence of lower uptake using available data and local insights. Mobile outreach units are provided by the Scottish Ambulance Service. Some health boards have partnered, for example, with local transport providers to use their vehicles to offer transport to appointments for people who might struggle to get there. So there's a lot of work to reach under-vaccinated communities, and that work will continue, because it is really important that everybody who is eligible to get vaccinated comes forward and gets it, and they get the support to do so if that is needed.
Craig Hoy, to be followed by Neil Gray.
Thank you, Presiding Officer. Within hours of the public health guidance being issued, my constituent Joe Lawrence, who runs a catering business in East Lothian, sent me this message. Here we go again, £8,000 of cancellations this morning, just as we're getting back on our feet. Presiding Officer, last time around, many independent wedding, catering and hospitality firms, like Joe's, were excluded from major support schemes. So will the First Minister give a commitment to ensure that no such business is excluded this time around?
First Minister.
Look, I've set out very clearly and very candidly where we are with financial resources. We are making available every last penny of what we can do, and when we have a pot of money, there are difficult decisions to be made about how thinly that is spread versus giving perhaps a smaller group of businesses more significant advice. The Finance Secretary and our officials will consult with affected sectors and get to the best possible outcome to that. We will help as many businesses as we can. If there is more money now available from the UK Government, I hope that will allow us to do more, but we have to see the detail of that. These choices and these decisions are awful for businesses affected. I understand that. I think it's perfectly understandable that members come here and read out these things, but nobody should be under any illusions that I don't know the impact of this, that I don't understand how awful this is. But I don't have a choice, because I can't continue to tell people that it is safe to go to certain settings in groupings right now with Omicron running the way it is. I can't do that. So I have to make these choices. The Government has to make these choices, and we have to deal with the impacts to the best of our ability, and that is what we will continue to do.
Neil Gray, to be followed by Mark Griffin.
Thank you, Presiding Officer. As the First Minister has made clear, the evidence shows Omicron is a major threat to public health in Scotland. But while I appreciate what she announced today to provide some support to business, and the announcement from the Treasury released as the First Minister was on her feet, the Scottish Government's hands have clearly been tied and have been held up while the UK Government is unwilling to provide the necessary financial support. The Tory party is full of zealots who won't vote for public health measures, as we've seen over recent days at Westminster, and the Prime Minister doesn't have the political capital to push the necessary restrictions through, because last year Number 10 parted through lockdown. So does the First Minister agree that the UK Government's intransigence is putting lives at risk and that they must urgently change course?
First Minister.
Look, there is a real issue here, and it's not being political to point it out. For whatever reason, and whatever anybody's view of this is, and I'm not going to comment on that, I think it is very difficult for the UK Government to impose more protective measures, when my view is that these protective measures are really essential. Now, that is the right of the UK Government. Just as this Government is responsible for protecting public health in Scotland, they are responsible for that in England, and they are as entitled as we are to take the decisions they think are right. But what is not fair right now is that when they decide to do things, they can trigger financial support that is denied to us when we take decisions that we think are necessary. Now, hopefully, we get into a better position. I certainly have, and hopefully today's announcement is indicative of this, seen more of a willingness to listen to this point in recent days than has been the case at some previous points in the pandemic. But that's the basic issue of public health fairness at the heart of it, and that's the issue. It's not just me raising, the Welsh First Minister raises it, the Northern Irish First Minister raises it. The devolved governments are responsible for protecting public health, but if we are denied the wherewithal to do that, then we are in an invidious position that is not just unfair to the governments involved, fundamentally unfair to the populations we serve.
Thank you. Before we take the next question, there are many members who would like to put a question in this session, and I'd be grateful for short and succinct questions and responses. And I call Mark Griffin to be followed by Audrey Nicholl.
Thank you, Presiding Officer. The duty to work from home is recognition in workplaces that are an increased transmission risk. And it's been raised before that many key workers can't and face a continued heightened risk of getting COVID at work and then potentially long COVID. Can the Government set out what support will be offered to key workers now unable to work long-term due to long COVID caught doing their jobs? And does the First Minister accept that long COVID should be made an industrial disease in Scotland's benefit system now the UK Industrial Injuries Advisory Council refused to do so?
First Minister.
I certainly think there is an argument for that, and I'd certainly be more than happy to look in more detail at that and consider the Scottish Government's position. It is absolutely right that while we are advising people to work from home wherever they can and strengthening that requirement as of this week on businesses, it's not just that it reduces the risk of transmission in workplaces, it reduces the number of contacts people are having travelling to work or having lunch when they're at work. So it helps take away some transmission risk, and given what we're facing right now, that is important. Those who have to work, it's important that there are appropriate mitigations. Testing is one of the most important mitigations. And yes, people who suffer from long COVID and have long-term implications from that might affect their ability to work. Sickness pay is obviously reserved to the UK Government, and much of the benefit system is still reserved to the UK Government. So there will be issues here that we need to address, and I hope this Parliament will come together to help us put these issues very much on the radar screen of the UK Government.
Audrey Nicholl to be followed by Ross Greer.
Thank you, Presiding Officer. Over the last few days, I've been contacted by some constituents who have been experiencing difficulty obtaining lateral flow testing kits from their local pharmacies. So can the First Minister provide an assurance that everything possible will be done to secure adequate supplies of kits that are available at pharmacies, especially for those that are unable to use alternative options such as ordering online?
First Minister.
Yes, we'll take steps to do that. I haven't been aware of particular issues at local pharmacies. There are, I think, over 1,000 community pharmacies and dispensing GPs across the country providing access to lateral flow tests. Community pharmacies and dispensing GPs can place daily orders to ensure sufficient supply. We're working with the UK Government to encourage pharmacies to place daily orders and increase the amount of tests they're able to order each day where needed. In the event of any supply issues in a particular pharmacy, people will be redirected to collect at another local pharmacy or a local testing site. And if you want to know where the nearest source of LFDs are to you, you can go onto the website, put in your postcode, and that will tell you. Generally, I raised this at a Four Nations discussion on Sunday. We need to make sure, with the higher demand for LFDs, which is a good thing, really positive thing, that the procurement and the supply stays healthy. And I know the team within the UK Government responsible for this is working extremely hard to do that. There was a temporary issue with the online ordering system yesterday, which has been rectified today, but it's really important that we keep the supply of these tests flowing because they are really important as part of our defence.
Ross Greer to be followed by Joe Fitzpatrick.
Thank you. Given that the one thing we do know about the Omicron variant is its significant increased transmissibility, can I ask why the guidance for identifying close contacts in schools has not been immediately revised? Will this not result in more pupils and staff having to miss time from school because transmissions have been missed and outbreaks are worse than was otherwise necessary?
First Minister.
Look, we keep all of these things under review, and I think particularly with schools it's a really fine balance to strike. We want to minimise the risk of children's education being disrupted. So if we have a blanket self-isolation policy for any for a whole class where one pupil tests positive, we will very quickly see large numbers of pupils and classes isolating. On the other hand, as Ross Greer rightly says, we don't want to have a situation where we're allowing the virus to spread more easily in schools than it would otherwise do. That's why the risk-based approach that Test and Protect uses is so important. But as this situation develops, we are going to have to keep all of this under review to strike that right balance between protection and allowing schools and the economy and critical services to operate. None of this is easy. None of it has ever been easy. It's going to be tricky in the weeks ahead, but there's a real focus in trying to get these balances as right as possible.
Jo Fitzpatrick, to be followed by Liam Kerr.
Hospitality businesses in Dundee have contacted me to express their concern about the impact of the new variant on trading over the festive period. Those businesses will welcome the announcement of £100 million support today from the Scottish Government. But does the First Minister agree that while this is welcome, today's Treasury announcement about unspecified financial support just moments before this statement highlights yet again that while we're in the grips of this horrible pandemic, current funding arrangements across the UK are dysfunctional and that greater certainty is required from Westminster and quickly, not only for the Scottish Government, but also for those businesses who are facing a festive period of challenge, and the Scottish Government really needs to press the UK Government for early clarity on this.
First Minister.
Yes, I do agree, and we are pressing both for funding arrangements that, even if just in the COVID context, are more appropriate to the situation we face, and for as much clarity as possible. I'm not going to repeat what I said about not knowing the detail of what was announced just after 2 o'clock. This is just a basic issue of good sense when it comes to dealing with a pandemic. We cannot have our public health hands tied by funding arrangements that are asymmetrical and unfair to the devolved administration. So hopefully we're going to see some progress here, but it is really important that we all have maximum ability to steer our way through this next phase of the pandemic without businesses unduly paying the cost of what we do because we don't have the wherewithal to properly compensate them.
Liam Kerr, to be followed by Willie Coffey.
Thank you, Presiding Officer. The public health guidance on Thursday took many businesses, especially those in hospitality, by surprise, with absolutely no time to prepare. What action will the Scottish Government be taking going forward to ensure that this situation doesn't happen again and that all possible steps are taken to give businesses adequate time to prepare for new measures and guidance?
First Minister.
We'll do that as far as possible, and I understand the frustration, the anxiety, the distress on the part of businesses that have had 2 years now, as we all have, of guidance that changes as the pandemic changes. But I would ask all members to listen to what I said earlier on. This variant of the virus, cases are doubling every 2 to 3 days. It is moving faster than anything we have dealt with before in the whole course of the pandemic, and that is quite a statement because we've dealt with really difficult situations before. So speed of response right now is more important than it has ever been. I understand that businesses would prefer we waited a few days to tell them what we were going to do a week hence and give them time to prepare. But in a week, this virus will have doubled, 3-4 times, this variant of the virus. So that's why speed is so important. And I don't say that with I wish we weren't in this situation, but we are, and we don't do businesses or anybody else in society any favours if we don't try to act as fast as the virus is replicating.
Willie Coffey, to be followed by Michael Mara.
Thank you. First Minister, some hospitality groups are saying that you have just asked people, and I quote, to stay away from their restaurants and facilities. Would you mind clarifying this so that everyone is totally clear what's being asked and what isn't?
First Minister.
I think I did make it clear in my statement. I am not trying to override the judgment of every person. We've 2 years into this. People have a lot of experience of this and people need to be able to make judgments. But I am saying in the run-up to Christmas and then after the core celebrations of Christmas, people should reduce their contacts with people in other households as far as possible. That means minimising socialising. That will help us to slow down this virus while we get more and more people boosted. Secondly, though, because I appreciate some people will want to socialise and will socialise, So if that is the case, and my advice is to minimise that, but if you're doing that, whether that is in your own home or in hospitality, try to limit the households that are in your group to a maximum of 3. And I'm trying to explain why that is important. That kind of thing's always been important with an infectious virus, but the attack rate of Omicron means that if you're in a group of people, and we've seen this in outbreaks over the last 2 weeks, if you're in a group of people where one person is infected, all of our evidence since the emergence of Omicron is that the majority of people in that group are being infected. That almost took out an accident and emergency unit in Lanarkshire last week. So that's why we're giving this advice. It's horrible advice. It's the last thing people want to hear, but it is essential if we are to get on top of this virus before it overwhelms us.
Michael Mara, to be followed by Stuart McMillan.
Thank you, Presiding Officer. In her statement, the First Minister advocated continued lateral flow tests for secondary school pupils. School testing figures currently sit at below 4%. Test and Protect has been abandoned in classrooms, and there's been no action beyond opening some windows on classroom ventilation. Further to this, the promised laptops for all are not in the hands of pupils. Presiding Officer, this government has done nothing to help keep schools open and done nothing to help prepare them in case of closing. Can we assume the government will be working now to ensure, after 2 years, maximum safety measures are in place so that schools definitely reopen in January?
First Minister.
I'm just going to be blunt, President Officer. I think that was a deeply irresponsible contribution. And not only irresponsible because it mischaracterises the position of Test and Protect, it's an insult to those who are working in Test and Protect to help schools stay safe every single day on a risk-based approach, trying to strike the right balance between protection and keeping children's education. We distributed laptops and connections to tens of thousands of children at an earlier stage in the pandemic, having identified those most at risk, and we'll continue to do everything we can to keep schools open, because as we see today in the attainment figures, that is really important for the sake of children's learning and education. Now, as I say that, I absolutely accept that schools must also be safe for children and for staff, which is why we've given local authorities additional resources to help with ventilation, and the Education Advisory Subgroup is looking at all of this again right now. By all means, scrutinise this, but don't, please, in the midst of this crisis, come to the Chamber and irresponsibly mischaracterise the situation.
Stuart McMillan, to be followed by Tess White.
Thank you, Presiding Officer. I'd be grateful if the First Minister could provide an update as to whether any consideration has been provided to give new guidance to large-scale events, including sporting and recreation, to actually help slow down the transmission of this new variant.
First Minister.
The guidance we've given today is to people around the interactions they have with people in other households. That's specifically for indoor events. We're also looking, as I said, at strengthening face covering requirements, and we will be looking as part of that in terms of whether we want to encourage people to wear face coverings even outdoors in some crowded events. We're not cancelling events at the moment. We will continue to look at, particularly if we have more financial wherewithal to compensate companies and events, whether there is more proportionate action we can take. But the advice we're given today is the advice that has been set out in my statement, which will be backed up with more detail and guidance to be issued over the course of this week.
Tess White, to be followed by John Mason.
Thank you, Presiding Officer. First Minister, as we know, the size of the vaccination workforce is pivotal to the delivery of the accelerated booster programme. This afternoon's statement indicated the Scottish Government's will to extend the number and role of volunteers. Would it be possible to provide more details of how and when this is likely to be achieved?
First Minister.
As we speak, I'd encourage all MSPs to think about maybe volunteering over the Christmas break in a local vaccination centre if there is a need of volunteers. I've asked all ministers to think about doing that if it would be helpful. I said last week in terms of the full-time or not full-time paid professional workforce, we had already increased that by 300 full-time equivalent posts. There are many people who want to volunteer right now. We'll make available details of how people go about registering their interest. Obviously, volunteers are restricted in what they can do, but the activity and the contribution of volunteers can help free up some of the time, reception tasks or stewarding people who are turning up for vaccination. That frees up time of clinical staff to actually do the vaccination. So all hands on deck over these next few weeks to get these booster jags into as many arms as we can, as fast as we can.
John Mason, to be followed by Graham Simpson.
Thank you. On Saturday, I was at the Theatre Royal in Glasgow, and they insisted on people either having had a vaccine or a negative test, which I thought was extremely good. Would the First Minister agree with me that if venues should go above and beyond what the law says?
First Minister.
Yeah, I mean, I would congratulate any venues, and I know there are many, many of them who are really going the extra mile to try to keep the venues and those who go to them, either performers or spectators, as safe as possible. So I would encourage, in fact, what I refer to today, we will be putting a legal obligation on those who run businesses and provide services to make sure they're taking all practical measures to keep their premises as free from transmission as possible. We know nobody can eradicate the risk of transmission. It's really important to be clear about that, but there's lots of things we know we can do to reduce the risk, and I would pay credit to and give my appreciation to businesses the length and breadth of the country who are seeking to do that.
Graham Simpson, to be followed by Colette Stevenson.
Thank you. I had my booster jab yesterday. The guy who put the needle in my arm was at the start of a 12-hour shift. Now, you're not going to be able to do too many of them without getting exhausted. So what are we doing to protect the army of heroes who are delivering the vaccination programme, and how many extra vaccinators do you think we need?
First Minister.
We've already increased the numbers. I said last week, I've just repeated today, we've already added 300 full-time equivalent. We're training, health boards are training new vaccinators, we're recruiting extra volunteers. All of us are having to do this. My appreciation knows no bounds to those who are doing the vaccination. I had a good conversation when I went for my own booster a week or so ago with the lead nurse there about the pressures they're under, but also about the heroic work that they are doing. It's often glib that we talk about the contribution NHS workers make to all of our lives, but right now everybody who's helping with this vaccination effort is literally saving lives and helping the country get through the most difficult period. So we owe them a huge debt of gratitude, but the government owes them the support they need, and that is what we are absolutely focused on providing as we ask them to do even more over these next few weeks.
Colette Stevenson, to be followed by Paul O'Kane.
Presiding Officer, it has been reported that around 120 staff from University Hospital here Myers in my constituency are isolating following a COVID outbreak. What discussions has the Scottish Government had with NHS Lanarkshire on this matter, and what support, logistical or otherwise, will be provided to ensure patients are seen?
First Minister.
We are aware of the situation at Hare Myers through the daily contact that the Health Secretary and or officials have with health boards. NHS Lanarkshire is under significant and sustained pressure, but have confirmed that they are deploying staff from other areas to ensure that services can deliver key and effective patient care. We will continue to work closely with all boards, including Lanarkshire, to review their contingency plans and assist in any way possible, for instance, where appropriate through mutual and military aid, but also making sure that appropriate use is made of the exemption system to allow critical workers to return to work on the basis of certain precautions.
Paul O'Kane, to be followed by Claire Adamson.
Thank you, Presiding Officer. I've been contacted by constituents, and there have been press reports in the past few days of people deeply concerned that an elderly relative has not received their booster vaccination due to a prolonged stay in hospital. Despite being in hospital through autumn, many have been told by NHS Greater Glasgow and Clyde that they can only be vaccinated in the community. With the huge problem of delayed discharge and the imperative to ensure that everyone has a booster, can the First Minister confirm if boosters will be administered urgently to those in hospitals if it is clinically appropriate?
First Minister.
There's no blanket policy that says elderly patients in hospital cannot be vaccinated in the hospital. It's down to the clinical decision and judgment. I will certainly ask the Health Secretary to look to see whether we need to issue any more guidance to health boards to ensure that that happens.
Claire Adamson, to be followed by Finlay Carson.
Thank you, Presiding Officer. First Minister, we've talked a lot about the impact that this has had on our health service, but it's also impacting other public service like our court system. Can I ask what has been done by the Scottish Government to deal with a significant backlog of cases and ensure a criminal justice system can start to clear this backlog?
First Minister.
Well, the Courts and Tribunal Service are working very hard on plans to clear the backlog, which is more in the criminal side than in the civil case. A lot of civil businesses continue to happen online. Of course, there have been measures in order to minimise the impact on criminal business, but that has been more severe. I discussed this issue directly with the Lord President just last week, and obviously the budget helps ensure that there are resources there for the Court Service and the Crown Office to continue with their recovery work.
Finlay Carson, to be followed by Katie Clark.
Given that the guidance set out today relies heavily on everyone taking personal responsibility and that changing rules around COVID can be confusing, so providing good, easily understandable information is key, and that certainly wasn't the case on Thursday evening, with the public and businesses being hugely let down by the lack of clear guidance. And I assume the First Minister agrees that good communication is critical. So why has the Scottish Government once again removed ITV Border from TV advertising schedules, meaning that viewers in Dumfries and Galloway and the Scottish borders won't see Scottish Government COVID and other related public information messages on Channel 3? And why is providing information in the south of Scotland less important than elsewhere, given you continue to spend on STV?
I mean, for goodness sake, can I ask members, why on earth would I want to stop public health messages getting to people in every part of Scotland? What could my possible motivation be? And coming from Conservatives who spend a lot of their time trying to prevent me giving public health messages to the public, it's a bit rich. I don't know why that is the case. I will look into urgently, but actually a lot of, not all, but many of our public health messages right now are being done on a UK-wide basis. We're actually cooperating with the UK Government to ensure consistency of messaging. So, you know, by all means, yeah, raise these things, but raising them in a tone of voice that suggests that somehow I've got a motivation to stop people in the south of Scotland getting public health messages is utterly ridiculous.
Katie Clark, to be followed by James Dornan.
Thank you, Presiding Officer. Further restrictions are clearly necessary, but does the First Minister agree that people are willing to comply with restrictions when they think they are consistent and fair? And it's going to be difficult to explain why people are allowed to mix at large events when small family gatherings are having restrictions put on them.
First Minister.
Well, firstly, we are going to, in guidance, be asking public places where people are gathering to start to introduce measures to ensure safety. I talked in particular about hospitality and the need to ensure that there's not crowding between tables, because we're asking people to stay in smaller groups if they are in these places. So we will be giving that message consistently, whether you're in your own home or in a public place. I've set out very candidly today why we can't do more around some of the public places for financial reasons, although, as I've said, we will look again at that to see if there is any more we can do to support some sensible measures there. I understand the importance of people understanding. That's why I'm setting out today the reason for what we're asking people to do. But this is about just all of us trying to reduce our contacts as much as possible. If we all reduce our contacts a bit and as much as we can, we will reduce the overall ability for this virus to spread. So if that is easier for somebody to do by not going to hospitality, or if it's easier for them to do in their own home, whatever works for us, let's do it and all just take our contacts down in the run-up to Christmas. Then we can hopefully enjoy Christmas and not have that surge of infections after. None of this is guaranteed. This is a highly infectious variant of this virus, but that will give us the best possible chance of achieving a smoother path through this winter.
James Dornan, to be followed by Willie Rennie.
Thank you, Presiding Officer. Can the First Minister provide an update as to what support the Scottish Government is making available to GP surgeries in Scotland to expand the level of care provided to patients?
First Minister.
We're providing funding of £30 million to support GP practices to continue providing a high level of care to patients through winter. The funding will help with the provision of existing services. It will include supporting more face-to-face appointments, extra GP sessions, practice nurse time, non-core hours covering all appointments, for example. We do want face-to-face appointments to resume and to happen as necessary. I think it will be the case that many people will continue to prefer online or telephone appointments with their GP, but we need to make sure that balance is right. GPs have been working extremely hard over the course of this pandemic, providing essential services, and it's right that we support them with this funding to help ensure they continue to do so.
Willie Rennie, to be followed by Maurice Gold.
I think the First Minister knows there is a glaring inconsistency between the household and the events gathering, as Katie Clark has just pointed out, and that she would like to go further if money is available. Now the UK Government has indicated there will be funds. Will she be returning to the Chamber tomorrow to give us greater certainty for businesses and jobs? Because I think events are going to be cancelled on today's guidance, and we do need guidance to be updated very quickly to avoid that.
First Minister.
I don't know, because I have no idea what money is on the table. So when I get out of the chamber and back to my office, maybe I'll have that information, but maybe I won't. So if there is more money, if that enables us to take other decisions that we think are appropriate, we have to go through a decision-making process when we arrive at further decisions. Yes, I will come to Parliament. Whether that will be tomorrow, I can't say at the moment. What I'd say to all MSPs is we all have a choice. These are difficult decisions, and when we're dealing with a pandemic, there are always inconsistencies, no matter what you do, because we're all trying to reduce contacts as much as possible. All of us have a choice where we can go around telling people about the inconsistencies, or we can help explain why things are as they are and encourage them to comply with the advice that we're giving, because that actually is in the overall national interest.
Maurice Golden, to be followed by Emma Harper.
Thank you, Presiding Officer. On what date will the guidance for businesses be issued, and what lead time will they have to implement it?
First Minister.
We're intending at this stage for the change in regulations to take effect at the end of this week, Friday, and the guidance will be issued before that. I come back again to the point I made, I think, to one of the members' colleagues. We want to give businesses as much time as possible, but let's just not lose sight of the fact we are facing a variant of this virus right now where cases are doubling every 2 to 3 days, but actually it's closer to 2 days. This is moving very fast, and if we don't try to move as fast as it is, then we're going to have very serious problems.
Emma Harper, to be followed by Sue Webber.
First Minister, constituents have contacted me who have family members flying into Scotland for the festive season and are due to arrive on December 23rd. This means that family members will not be able to obtain the required UK Government PCR test on December 26, 48 hours after arrival, due to the PCR providers being closed between Christmas and New Year, except for urgent reasons. Can the First Minister outline whether discussions are taking place with the UK Government about this issue, and whether she will encourage people to ensure they are aware of the current travel advice, especially regarding the PCR test requirements for persons coming to Scotland for the festive season, because many will have already booked their travel already?
First Minister.
So I think this is an issue I've addressed in the Chamber before. We encourage people coming into the country to take the PCR test on day 2 after their arrival, but they are actually able to take it, and the regulations have always allowed this within 2 days of arrival. So they don't have to wait until Boxing Day if they're arriving in the timescale that Emma Harper has set out. So they should make sure that they know how they will get their test. A list of testing providers is available on the UK Government's website.
Sue Webber, to be followed by Daniel Johnson.
Thank you, Deputy Presiding Officer. A 21-year-old constituent has contacted me asking something that hopefully the First Minister can clarify. She's asked me, and I'm quoting verbatim, "Am I being stupid? Pubs and restaurants have to socially distance, and you can't order at the bar, but you can still go to a nightclub." So it comes back down to nightclubs again. What are the recommendations for this already hard-hit hospitality sector, given the ongoing specific pressures on nightclubs?
First Minister.
I would have encouraged the member to listen to the statement. We will issue guidance. We're asking businesses and hospitality to take measures that will avoid crowding at bars. We have not asked so far to go back to table service. We're trying to be as proportionate as possible while having an impact on transmission. If the member wants to say to me that we should close nightclubs, then she should perhaps say that, and if there is funding there, then we can consider that. I don't want to close any business, again, let me add, if it can be properly avoided. There is never going to be 100% consistency. There never has been on this, and since the days we simply made everybody stay at home all day, apart from going out for one walk. I think as elected representatives, we have a duty right now to help explain to people why they're being asked to do certain things and why one thing might look a bit inconsistent to another. We are political opponents across this chamber. We have vigorous disagreements, but we are again in the teeth of a serious public health crisis. And I think our overriding duty is to unite to help explain the advice to the people of Scotland so that they have the best chance of following it.
And Daniel Johnson.
Thank you, Presiding Officer. Can I ask the First Minister for further detail about the supply of lateral flow devices? While the website is back up and running, it's currently stating that there are no lateral flow devices available to order. Can I ask whether or not she's confident there is sufficient supply, both in current circulation and on order, to enable people to lateral flow as frequently as we all need them to? First Minister.
Yes, supplies, and I'll come on to the point with the online system in a moment. Supplies are under pressure because demand is rising, and that's a good thing. Let me say, just again, as a statement of fact, although all the devolved nations contribute financially to this, the procurement and the distribution is done on a UK-wide basis. The issue yesterday with the online system, and it may be that that issue has kicked in again while I've been in the chamber, is not supply, it's distribution. There has been, and there is work underway to increase this. There has been a limit to the number that can be distributed through the Royal Mail on a daily basis, and that number has been breached in recent days because of the increased demand. So that's a distribution issue, not a supply issue. And because it's not a supply issue, we can say with confidence, although I know there are other procurement efforts underway, that people, if they can order online, they can go to a local pharmacy or test site and get supplies. And supplies are being distributed to local authorities to be made available in other areas as well. As I said before, took part in a Four Nations call on Sunday where the head of the testing system went into a lot of very helpful detail about the work that is underway to increase supply and to ensure that the distribution is sufficient. But it is not a problem with supply that led to the issue on the website.
Thank you. That concludes the First Minister's statement COVID-19 update. Can I inform members? Members may find it helpful to know that the Parliamentary Bureau has met 6 times since Thursday, 6 times since Thursday, for the sole purpose of ensuring that the Parliament has the appropriate opportunity to scrutinise the Scottish Government on any significant announcement about Scotland's response to COVID-19. The Bureau agreed to propose that the statement in question session today be extended to allow as many members as possible to put questions. And through these discussions, the Government is fully aware that, as far as possible, all significant announcements should be made to the Parliament. And I want to ensure that members have the opportunity to scrutinise the Government's response to ongoing developments relating to coronavirus and to represent their constituents. And this may include meetings on Mondays and Fridays to maximise those opportunities. Now, the Bureau will continue to monitor the situation closely and on a daily basis, not just during the remaining 2 weeks of this term, but also during the recess when Parliament can be recalled as required. And we'll now move on to the next item of business, which is topical questions. But can I remind members of the COVID-related measures that are in place and that face coverings should be worn when moving around the chamber and across the Holyrood campus. I call it question number 1. Actually, Mr Balfour, I'll give you a moment until the chamber quietens down a little. Thank you. We'll just give colleagues a moment to move places. Topical questions. Question number 1, Jeremy Balfour.
Thank you, President Officer. To ask the Scottish Government whether it will provide an update on what flexibility will be afforded to the installation of interlinked fire alarms in light of recent reports about available funding for low-income households.
Cabinet Secretary Fiona Robertson.
Thank you. Flexibility is built into the existing legislation through a provision setting out that the work should be done within such period as is reasonable in all of the circumstances. So this allows flexibility for homeowners who are unable to install alarms by the 1st of February 2022. Homeowners are generally responsible for paying for works to protect their property. However, in recognition that some may not be able to meet the cost of fitting the necessary alarms, we provided additional funding of £500,000 to Care and Repair Scotland to help older and disabled people. And this was in addition to the £1 million funding to the Scottish Fire and Rescue Service for their Home Fire Safety Visit programme to install alarms for those owner-occupiers who are assessed as being at highest risk from fire. Furthermore, our £15 million loan funding to social landlords has enabled them to fit compliant alarms to the new standard by next year.
Jeremy Balfour.
Can I thank the Cabinet Secretary for her answer? But I wonder, can she define what is a reasonable period and what is the cut-off date when the law will be enforced, so that people can have certainty when this work needs to be done, rather than just some kind of vague, reasonable time?
Cabinet Secretary.
Well, a reasonable period is something that's quite often used within legislation. So it's not defined as a certain number of weeks or a certain number of months. It just means a reasonable period of time for someone to get the system installed, because we do understand that there have been some supply issues around the supply of the fire alarm systems. We recognise that. So that is why we're prepared to give people that reasonable period in order that they can have a bit of breathing space should they be finding it difficult either to get their hands on the device or indeed get it fitted. And as I've set out in my initial answer, there is support available to those who require assistance in order to do that.
Jeremy Balfour.
Can I push the Cabinet Secretary on this? There is going to be issues around house insurance if these alarms are not fitted at the appropriate time. So what conversations has the Cabinet Secretary had with house insurance in regard to whether that policy will be valid or not? And at what point will they decide that the date has become reasonable or not? There must be at some point a date fixed by government, or are they simply not willing to make that decision?
Cabinet Secretary.
Well, can I say to Jeremy Balfour that we have not said in any way that this should be taken into account by those insurance companies. Insurance policies are obviously a matter between the insurance company and those holding the insurance policy, but we've never specified or said that this should be included within it. As I said in my original answer, I want the legislation provides the flexibility for work to be completed within a reasonable period, taking into account individual circumstances. I think that is a reasonable position. I mean, at the end of the day, this is about getting the message across to people that we want them to install these devices because it improves the fire safety within their homes. Of course, this originated out of the Grenfell tragedy, so it is important that we all give a message to homeowners that this is an important thing that they should do as quickly as possible.
Christine Graham.
Thank you very much, Presiding Officer. I absolutely accept the necessity of people being safe. However, with the current pressures of Omicron, which is very distracting for people just now, quite rightly, and the rising cost of energy, can I say I welcome flexibility in the deadline, and I hope the Cabinet Secretary will take into account these other pressures on households just now, quite apart from obtaining the devices and having them installed.
Cabinet Secretary.
Well, Christine Graham makes a reasonable point. People are understandably concerned about having the necessary alarms fitted by the deadline of the 1st of February, and I do understand the current challenges with living costs and COVID, as the member pointed out. So that's why I do want to emphasise that the legislation does provide that flexibility, and careful consideration is needed to balance the risks associated with even further delays of the legislation, which I'm not keen on, because at the end of the day, this is about improving fire safety. One death from a fire in Scotland's homes is one too many. So this is important that we give a message that people should prioritise making this investment. And of course, we have the supports available for people who will struggle with that.
Mark Griffin.
Thank you, President Officer. The Cabinet Secretary has alluded to this, but colleagues in local government have told me that deliveries of orders of the interlinked alarms are being delayed, and that's in part due to the global semiconductor shortage, but also because of the disruption in trade due to the pandemic. And in short, there's not enough to go around. What can the Cabinet Secretary say about what flexibility there is? Spoken about a reasonable allowance, but people are worried about breaking the law after the 1st of February. And what more consideration is the Cabinet Secretary given to a fixed date delay to introduction of this legislation?
Cabinet Secretary.
Well, can I say first of all that of course I'm aware that some manufacturers are facing supply issues particularly with imported components. Some manufacturers do have stock availability, and specialist retailers are also able to meet demand subject to logistical challenges. Now, my officials are in discussion with manufacturers to establish when supply issues are likely to be resolved more generally. But that's why, as I've said in the previous two answers, that we are giving that level of flexibility. It is important that people get these devices installed as quickly as they can, because it improves the safety of them and others within the home. But we do recognise, because of these challenges, that people need a bit of flexibility, and that's why we're giving that reasonable time frame for people to comply with the law.
Question number 2, Fiona Hyslop.
To ask the Scottish Government what action it will take in response to the British Academy of Audiology report on NHS Lothian's Paediatric Audiology Services, which was requested by NHS Lothian following a review by the Scottish Public Services Ombudsman.
Cabinet Secretary Humza Yousaf.
Last week I made clear my views of the unacceptable failures highlighted by the British Academy of Audiology report into the provision of paediatric audiology in NHS Lothian. Our priority is to restore and rebuild confidence, ensure support is provided to those affected by the situation in Lothian, and to ensure this is not repeated for any other family. In response to these ongoing issues, NHS Lothian has been escalated to Stage 3 of the NHS Board Performance Escalation Framework for paediatric audiology performance and service delivery. Yesterday I met again with the board leadership team. We'll work in partnership with the board to develop a formal recovery plan. We agree with the BEA's recommendation to share this report more widely for greater learning in Scotland and across the UK. It is necessary a response to the findings, and the concerns raised assure children and their families across Scotland that their child is getting the best possible audiology care. For all these reasons, I'll be writing to health boards to seek assurance on quality of care.
Fiona Hyslop.
6 children could and should have received cochlear implantation surgery, but were missed in assessment and missed out on life-changing surgery. This was set out by NHS Lothian in a briefing I attended on Friday. Why should it have taken concerns being taken all the way to the Scottish Public Services Ombudsman for this failure of service to be identified? And what can the Cabinet Secretary do to ensure health boards take concerns seriously to assess if there are underlying systemic issues needing to be addressed so that problems years in the making, such as this, are identified promptly?
Cabinet Secretary.
Fiona Hyslop is absolutely right to ask that question with the strength of feeling that she does. She asked me, I think if I got the phrasing of her question right, why should it have taken this complaint to have surfaced these issues? It should not have taken a complaint to have surfaced these issues. That is fundamentally the issue that the BAA brought forward in the report. There was a number of failures that, frankly, the BAA in their report brought to the attention of the Health Board. One of the most disturbing ones, I thought, was in some instances how dismissive of concerns and complaints those involved in that department were when parents came concerned about their own children. So in relation to what will be done next, as I say, there will be a formal recovery plan. It will look at the very issue that Fiona Hyslop raises and all of the issues that are raised by the various different reviews, including the BAA review.
Fiona Hyslop.
One of the concerns about how this service had been operating was that it was not a regulated statutory service and all training was in-house, which entrenched inadequate observational assessments for young children. What can be done to ensure this is not happening elsewhere in the health service? And will the Cabinet Secretary action the call on this from the Deaf Society and other recommendations they are making? And finally, and most importantly, what support and assurances have been given to the children and families affected, and how can trust in this service be restored?
Cabinet Secretary.
There was three questions there which I'll try to answer very quickly. I am meeting with the BA and the National Deaf Children's Society, an organisation I've known for many years. I'm meeting with them later this week, and I've seen their recommendations that they have made, and will consider them with an absolutely open mind. I've already asked Lothian in terms of assurance if certain frankly red flags were missed in the Paediatric Audiology Department. How can they give me assurance that similar issues and complaints are, if they're being flagged in other departments, how are they being surfaced? I've also asked all health boards, and will ask them formally, but I've asked them informally, to look at their own paediatric audiology departments to ensure that these same issues are not present there. In terms of the point that Fiona Hyslop raises about regulation, it's a very good one. I'm having discussions with the UK Government about reform of professional healthcare regulation at the moment, and I should say even before this report, I was in favour of looking at regulation for audiologists. This report has just strengthened that feeling.
Sue Webber.
Thank you very much, Presiding Officer. The shocking review reveals the completely inadequate level of care given to youngsters with hearing difficulties in NHS Lothian. And many of the families deserve an explanation of how this scandal could happen. These critical failings have, sadly, a lifelong and significant impact on these young people and their families. And I am very pleased that NHS Lothian have accepted all of the recommendations from the audiology report. But I am concerned that this could happen elsewhere. And as stated, the National Deaf Children's Society is calling for an independent review of children's audiology services across Scotland, which is more than what the Cabinet Secretary has stated he's going to do today. So there is a real danger of many more deaf children not getting the quality of care unless this review is carried out across all of our services across Scotland. So when will such a review take place, and when? Thank you, Cabinet Secretary.
Cabinet Secretary.
Well, I think Sue Webber raises a number of important points. I should have said, and I omitted to say in my answer to Fiona Hyslop, that the NHS Lothian did issue letters to the affected families last week, and measures are in place to identify any young child whose cases may require further clinical review, and also there is a helpline available too. But I have asked that NHS Lothian keep close to those families that have been affected. In terms of the broader point, I will meet with the National Deaf Children's Society later this week. What I would say to Ms Webber is that I would like health boards to look at their own paediatric audiology departments, thoroughly examine and explore if any of the issues that were raised by the BA report are also present in their own health boards. If I find that any of those issues are more widespread, any suggestion that they're more widespread, then of course an independent review might be the appropriate thing to do. But what I wouldn't do is rush into that before I let the health boards do the work they'll do. But it will be done at pace, and Ms Webber is absolutely right to raise the concern that this could be more widespread than just NHS Lothian. But that is what I am exploring and examining. I'm happy to give all members that have expressed an interest in this an update when that review is complete.
And Daniel Johnson.
Thank you, Presiding Officer. Can I associate myself with the tenor and remarks from Fiona Hyslop, because I too attended the briefing on Friday. Can I also ask further, in terms of the welcome points from the Cabinet Secretary, that this clearly goes beyond just the technical application of a test. There is clearly fundamental problems with the culture in this unit, as identified in Section 4 of the audit report. So can I ask what is going to be done to tackle that culture? Secondly, on the red flags, does he think that he needs to go further than simply ask that question, and do other areas of practice not subject to statutory regulation need to be examined more fully? And finally, can I ask, these children who have had life-altering consequences from this failure, will the government examine putting together a compensation process so those families don't have to go to court to get the support and financial support that they need for their children and their ongoing needs through the rest of their lives?
Cabinet Secretary.
Can I thank Daniel Johnson for the questions and the manner in which he asked them. In terms of the culture there, I will say two things. One, there are HR processes which NHS Lothian are taking forward. I wouldn't comment on them, and he wouldn't expect me to comment on those individual HR processes. But he is also right to say that the BAA in their recommendations recommend changes in terms of culture and practice, and NHS Lothian have had no hesitation in accepting those. But I will stress the points that he makes about culture when I meet with NHS Lothian next, which is very, very regularly. In terms of the points on regulation, I don't disagree with him. As I said to Fiona Hyslop, I'm in discussions at the moment around what healthcare services specialists should be regulated that aren't, and how the regulation can be perhaps more streamlined. So those discussions are ongoing. Again, if he has particular concerns about a particular specialism, then of course he can furnish me details with that, and I'm happy to have those conversations. In relation to compensation, again, I will look at what Daniel Johnson has to say. There are processes whereby, of course, individuals can seek compensation from NHS health boards if they feel that there has been negligence. He is right, we wouldn't want that to be a lengthy process if there is fault. Clearly, again, this would be a matter between the health board and the families, but I will take on board what Daniel Johnson has said and give it some further consideration.
Thank you. That concludes topical questions. There will be a very brief pause before the next item of business.
Okay, and the next item of business is a statement by Angela Constance on actions to increase access, choice and support through drug services in Scotland. The Minister will take questions at the end of her statement, and therefore there should be no interventions or interruptions. And I call on Angela Constance, Minister, around 10 minutes, please. Sorry, Minister, have you got your card in?
You're not going to make me shout, are you?
Minister, 10 minutes from now.
Thank you, Presiding Officer. The loss of life in Scotland from drug-related deaths is still as heartbreaking as it is unacceptable, and I offer my condolences to all of those who have lost a loved one. My focus continues to be on doing everything possible to turn the tide on drug deaths. And 2 weeks ago, I updated Parliament on the progress we are making on building capacity and improving access to residential rehabilitation. Today, I am going to focus on the other main pillar of the national mission, medication-assisted treatment standards. This morning, I had hoped to visit services in Kirkcaldy, specifically to hear about the experience there on setting up same-day treatment and other MAT standards. Sadly, that visit could not go ahead today because of Omicron. From my visits to other areas where same-day treatment is already in place, I have seen and heard about the difference it has made for people. Introducing the MAT standards quickly has improved lives. First, though, I'd like to say a few words about the quarterly figures published today on suspected drug deaths. While these indicate that there may have been slightly fewer suspected deaths over the first 3 quarters of 2021 than there were for the same period in 2020, as I said to the Chamber in September when the first quarterly report was published, the figures remain high and there is still a long, long way to go. This report is on estimated drug deaths from Police Scotland. It's the second report published this year. It covers July to September. And while this report on suspected drug deaths can't be used to make accurate predictions about the status of the annual report for 2021, which will be about confirmed cases,
It helps services respond more quickly to what is needed and will help Parliament monitor progress. And in this vein, I can also announce today that I have approved investment of more than £1.1 million over 3 years in a range of measures to further help monitor progress. Surveillance projects will be developed on a new problem drug use prevalence estimate, a hospital-based toxicology study and improvements to the National Drug-Related Death Database. All of these projects will improve our real-time understanding of harms to enable faster and better responses. We know that treatment is protective, and my priorities start with getting more people into protective treatment on the back of our commitment to an additional investment of £250 million over the 5 years of this mission. And one of the most significant things we are doing to achieve this is implementing the medication-assisted treatment standards produced by the Drug Deaths Task Force in May 2021, and I am grateful to them for that work. Embedding these across Scotland by April 2022 is a key priority to give people access, choice and support through drug services. The MAT standards set out what people should expect and can demand of services. In June, Parliament agreed that I should provide regular updates on progress. And the first thing I'd like to report on is the launch of our stigma strategy last week. Stigma is a barrier to services for many people, a barrier to the services people have a right to, whether that is residential recovery or to MAT. And the need to tackle stigma is laced through the MAT standards, so this important campaign aims to get everyone to think about and talk about problem drug use in a much less judgmental way as a first step towards ending stigma. I can also report that I have now met with chairs, chief executives and chief officers across the country to get their assurances and commitments to have the standards embedded in a way which will make a real difference to the services people can access from day one. With the support of our national implementation team based in Public Health Scotland, we have helped all authorities assess their readiness, identify where they need extra support and produce project specification documents which are now being signed off by Integration Authority chief officers. I can also report good progress has been made in turning services around to improve access, choice and support. To help with this, we will provide around £6 million for this year to ensure all standards are fully embedded by April 2022. And I have committed to providing over £10 million per year for the next 4 years to ensure the standards are continuously improving. I'd like to highlight some of the key things that funding this year will help achieve. In Fife, we will be providing £300,000 per year to help set up a benzodiazepine-specific treatment service. This new service will directly address the growing risk of benzos contributing to drug deaths, and other areas will be able to learn from this. In Dundee, we are providing £600,000 per year to get more people into treatment through primary care. This is one of a suite of new approaches being taken in Dundee, signalling a change in its service model as recommended by the Dundee Drugs Commission. These examples of new approaches have been made possible by the additional funding which has come with the national mission. As I said to the Health, Social Care and Sport Committee in September, everyone is focused on getting MAT standards properly embedded by April 2022. But the work does not stop there. Over the life of the national mission, we want to see services improving continuously, and that this improvement is then sustained for people who need help and support. As you would expect, there will be tough challenges ahead. The implementation team and local services have identified some issues that have to be resolved. There were workforce challenges across health and care even before COVID. There are still some areas relying on very medicalised models of care, even when there is support available from other disciplines and from third sector partners. And we know that there will be particular challenges facing services in rural areas, distances to services for same-day treatment, for example. To overcome these challenges, we are supporting local areas to share best practice on solutions. We are also asking local services to adapt their care models to be less reliant on traditional medical models of care. to empower local third sector groups to do what they do best, providing flexible local alternatives at pace. And we're also encouraging local areas to adapt their primary care models to get more GP practices and community pharmacies involved in the care for people with problem drug use. This is the sort of flexibility that will be required to make the MAT standards sustainable. And what this will mean is that people will not have to wait days or even weeks to access MAT. Same-day treatment will become the norm. There will also be a wider choice of MAT available, with people having more choice of dosage and long-acting buprenorphine being made more widely available than it has been before. There will be better assertive outreach and anticipatory care in place to help people at high risk, either to start or to continue on MAT. And everyone in treatment will be given support to remain in treatment for as long as they need. This is particularly important through transitions from rehabilitation, from hospital and from prison. Services will be psychologically informed and help people grow social networks. Primary care and mental health care will be available alongside MAT, and all care will be trauma-informed, and advocacy and support for housing, welfare and income needs will also be available from MAT services. In my next 6-month report to Parliament on MAT in June 2022, I will be able to report on how authorities have moved beyond embedding the standards to improving on them. The implementation team will be working with services in March and April next year to gather evidence that the standards are all embedded. That evidence will be made available. It will be more than just proof that all the necessary processes and structures set out in the MAT standards are in place. And we have already begun training locally to gather evidence of progress from people using the services. Authorities will be relying on the experiential evidence to help show what has improved and to help make further sustainable improvements across the life of the national mission. Presiding Officer, no one should underestimate the scale of the challenge I have set for integration authorities and alcohol and drug partnerships to embed the MAT standards by April 2022. I certainly don't. But these standards will help make people's rights real, and I can report that we have already made good progress towards that. With this progress, we can improve and save lives as part of the national mission by increasing access, choice and support for people through drug services. Thank you.
Thank you very much indeed, Minister. The Minister will now take questions on the issues raised in her statement. I intend to allow around 20 minutes, after which we'll need to move on to the next item of business. As ever, if members wish to ask a question, could they please press the request to speak buttons or place an R in the chat function. And I call on Sue Webber.
Thank you, Deputy Presiding Officer, and I draw the Chamber's attention to my register of interests as a member of the Edinburgh Alcohol and Drug Partnership. 6 months ago, when Scotland's shocking drug death statistics for 2020 were first released, Nicola Sturgeon promised to get a grip on the crisis and pledged an additional £250 million to tackle the drug deaths emergency over the next 5 years. Last week's budget announced that there would be £147.6 million to address the twin public health emergencies of drug deaths and the harms from alcohol, including £61 million specifically to address the national tragedy of drug deaths, as part of our commitment to invest £250 million over the lifetime of this Parliament. But this same figure was £145.3 million in 2021-22's budget. And if we were to adjust the budget for inflation, this means the services are in fact facing a real terms cut of about £2.5 million. The First Minister pledged to get it right and provide funding. So where is the additional £250 million that was promised?
Minister.
Thank you, Presiding Officer. If I can start on a positive note, it's very useful for me to know that Ms Webber is a member of the Edinburgh Alcohol and Drugs Project, and I hope that will be a useful source of information for both of us going forward. With respect to the budget, can I suggest the member has been perhaps a little mischievous? The First Minister made a very clear commitment at the start of this year for an additional £250 million in addition to core alcohol and drug budgets. And that is reflected in the budget. It was a key manifesto commitment of this government, which we are following through. And I can assure Ms Webber that I am ensuring that every penny of that additional £250 million will be put to maximum use to both save and to improve lives. The Conservatives are, of course, more than welcome to pitch up to Parliament and argue for an extra £1 or £2 million. But I have pitched up to this Parliament with the full support of the First Minister and, crucially, the Finance Secretary, and brought to Parliament £255 million. £5 million at the very start of this calendar year in terms of emergency funding, and that crucial £250 million over the lifetime of the national mission. So we are delivering on our promises to invest and reform services, and I can assure Ms Webber that every penny of that will be put to good use.
Thank you. Claire Baker.
Thank you, Presiding Officer, and thank you to the Minister for advance sight of the statement. Today's recorded suspected drugs death figures are a sobering reminder of why we have the statement here today. I hope the reported decrease does mark the start of real improvement, but the fact remains the long-term trend is still moving upward and progress has been too slow. The update today is welcome and the Minister claims good progress is being made, but will the Minister be publishing any data or supporting documents for the progress she has described? It would be instructive, for example, to know how many EDPs are achieving MAT Standard 1 on same-day prescribing. Can I also ask what progress has been made with addressing the high fatality rate linked to street benzos? When in August the Benzodiazepine Working Group issued interim clinical guidance, the report from the Scottish Drugs Task Force today talks about a consensus meeting and then a conference. While I do welcome the specific treatment announcement that's been made for Fife today, in 2019, 70% of fatalities were linked to street benzos. If we are serious about addressing fatalities, the work here must be a priority. And finally, the Government must press ahead with safe consumption rooms as part of a package. I know there are barriers, but I don't accept they're insurmountable, and I cannot ask when the Government will bring forward a proposal on this issue. Minister.
Thank you, Presiding Officer. Ms Baker is quite correct to reflect on the sobering reminder of the suspected drug-related death statistics that were published today, and while they show a small decrease for the first 3 quarters of this year compared to last year, we have to report those facts as facts, and that there is some care needs to be taken and drawn too many conclusions from those statistics. So she is quite correct that these statistics have to be treated with care, because the bottom line is drug deaths in this country remain far too high. In terms of the data that we will be publishing, I obviously am briefed regularly by my officials. The position is ever-changing, with progress being made week in, week out. But as I outlined in my statement, what we will do is that we will gather the evidence and interrogate that evidence, and round about either prior or at the next 6-monthly statement progress report that I make to Parliament, we will publish more information so that members can see area by area, standard by standard. But can I also say to Ms Baker, and actually this is an open invitation to other MSPs as well, that if they want to come and engage about progress in any particular area, that I am happy to do that, that we are delving into the detail and scrutinising the delivery of MAT standards in all 30 alcohol and drug partnership areas. The point about benzos is really important. There are plans for a consensus roundtable discussion at the start of the year. This is an area that is quite hotly debated amongst clinicians. I am very keen that we build a consensus upon that, and that we're also in discussions with the UK Government around some legislative opportunities in and around prohibiting the sale and use of pill presses. And in terms of safer drug consumption facilities, we're pursuing 2 options. We, of course, continue to engage with the UK Government, but our detailed and delicate work about what we can do within our own powers continues, and like Ms Baker, I am absolutely determined.
Thank you, Minister. I'm conscious from earlier statements on this issue that there's a lot of interest around the Chamber and a lot of detail that the Minister can provide, but I'd be grateful, given the number of colleagues that want to get in, to have succinct questions and answers, please, from now on. Gillian Martin, to be followed by Craig Hoy.
Thank you, Presiding Officer. Problem alcohol and drug use doesn't just affect the person seeking treatment, but the family of the person too, in particular dependent children. I'd like to ask how the Minister is ensuring those who are parents get appropriate treatment choices that take their caring responsibilities into consideration. And the Minister also mentions stigma. Of course, the fear of repercussions and stigma for parents with alcohol and drug problems may prevent them from coming forward for treatment. So I'd be interested in a little bit more detail on how that's been addressed as well. Thank you.
Minister.
Thank you very much, Presiding Officer, and I will attempt to be brief. The issue of stigma that Ms Martin has highlighted is of particular importance to overcoming barriers to supporting women to achieve the necessary access to the necessary services that they need. Ms Martin will be familiar with the work that we have undertaken with respect to residential rehabilitation and filling the gaps in services there with respect to women and children. On Wednesday, last week, I launched the framework to improve holistic family support. I did that at the Beacons in Blantyre, and this is about the importance of family-friendly services. But this framework is also backed up with funds totalling £6.5 million. And the Drugs Death Task Force recently published a report on women and drug-related deaths, making a range of recommendations around developing services, collaboration, sharing information and workforce training, and these will be taken forward as part of the implementation of MAT standards.
Thank you. Craig Hoy, to be followed by Alistair Allen.
Thank you, Deputy Presiding Officer. Between 2006 and 7 and 2015 and 16, cocaine was the main drug of between 5 and 8% of all drug users. But that figure rose to 21% in the most recent data released in March. As part of the national conversation on drugs, what would the Minister's message be to those regular cocaine users, very many of whom believe their use is simply recreational, and who would never therefore think of seeking out help, support or treatment?
Minister.
Mr Hoy is quite correct to point to the growing implication of cocaine use in drug-related deaths. It is a matter that I'm paying particularly close attention to, and I've been discussing with a range of services, including the Alcohol and Drug Partnership in my own local area of West Lothian, where there are particular concerns about young men using cocaine on a regular basis, and the particular harms that is associated with in terms of debt, financial pressures, and also their mental health. There are, in terms of treatment options around for cocaine use, it is imperative that people do come forward to seek help in that regard, and there is a need in terms of cocaine use to have very person-centred approaches, and to quite often to employ more motivational approaches as well, to help people identify the problems that cocaine is causing them in their lives, and to work out person-specific plans to help overcome that.
Thank you. The next three colleagues join us remotely. Firstly, Alistair Allen, to be followed by Katie Clark.
To ask the Minister what action the Scottish Government is taking to improve drug services in rural areas where there is often less choice of services, and in particular how third sector organisations such as the SHED project in my own constituency are being enabled to continue and expand on the vital work they do to support people, including those who are struggling with addiction.
Minister.
I thank Mr Allen for that question. Local initiatives such as the SHED project in his own constituency, which provides drop-in services tailored for people with alcohol or drug-related problems, is absolutely vital to the delivery of services in rural areas. There are specific challenges for rural areas just because of the geography and distances travelled, but nonetheless I am clear that MAT standards have to be delivered in all parts of Scotland although the solutions for rural areas may need to be more innovative and may need to be more flexible. And that's why the MAT implementation support team are working with a range of rural services to share best practice and are also working hard to find solutions to those unique challenges, and that has also been supported with additional financial resource, which this year was initially identified for £4 million but has now increased to £6 million.
Thank you. Katie Clark, to be followed by Stephanie Callaghan.
I have no doubt that the Minister agrees that it is important to have the community on side with maximum consultation on all aspects of drugs policy. And I know this was raised with her before, when North Ayrshire Council, community councils and the local community found out about the national drugs facility that's intended for Saltcoats in the media. Going forward, could she outline what she thinks she can do to ensure that there's maximum consultation, and also can she provide an update on what's happening in relation to the Saltcoats facility so that can be shared with the community?
Minister.
Thank you, Presiding Officer. And I imagine that Ms Clark is aware that this particular question was covered rather comprehensively in my last statement to Parliament. But can I just reiterate, I have a responsibility to lead a national mission. There were gaps identified in services available to women and families. We sought to address that. I have, of course, engaged with some local councillors in the area, also the local constituency member, Mr Gibson, and can I assure Chamber that Phoenix Futures have a great track record in working with communities, and they have a great track record in saving lives and improving lives, and we can see that in the project, the very similar project that they have run in Sheffield for the past 25 years.
Thank you. Stephanie Callaghan, to be followed by Willie Rennie.
Thank you. Presiding Officer, can the Minister outline whether health boards will be encouraged to carry out their own local consultations to ensure that their services are increased? This surely is progressing in a way that best meets the needs and the circumstances of our local service users.
Minister.
Two points I would like to raise, Presiding Officer, is that keys with an additional £500,000 this year, and for the life of the national mission to increase and improve their engagement with people with lived and living experience of drug use. And also, as part of our specific work around the implementation of MAT standards, as I referred to in my statement, we are recruiting local people so that we can be really bear down on the detail of good qualitative evidence from those who matter most, and that's about people who are trying to access services or people who are in services. So there is investment in peer-to-peer research in this regard that is particularly important.
Thank you. Willie Rennie, to be followed by Stuart McMillan.
I do want to thank the Minister for her detailed work. The big question is whether it's enough to meet the enormous challenge that has built up with the highest drug death rate in Europe. There has been a significant increase, as I'm sure the Minister knows, in the number of deaths of homeless people with drug misuse as a major factor. What has she learnt from those deaths? And what plan does the Minister have to improve stabilisation services?
Minister.
I'm very appreciative to Mr Rennie for those questions, because the point about stabilisation services is actually very important, and it relates to the concerns that we have around alcohol, but also benzodiazepines, and that whether we're talking about detoxification or stabilising people who are in chaos, are in crisis, that often needs to be done in supervised environments with the correct medical and clinical support. And we have received a report from the Drugs Deaths Task Force making recommendations around stabilisation services. I've been to visit a few stabilisation services, and we are taking that forward. In terms of the points that he raises around the correlation between homelessness and drug deaths, I think the bottom line for me is we don't have enough people in treatment. And that is on us, and that is why at the very core of our national mission to save and to improve lives is to get more people into treatment. But that means we have to work harder to prevent people becoming homeless in the first place, but also work harder to reach people who are perhaps further away from services. And Mr Rennie is quite correct to point to the scale of the challenge, but we can make a difference. These deaths are avoidable and preventable. There is evidence around the world about what we need to do.
Thank you. We've got 3.5 minutes and 4 speakers, so as briefly as possible, Stuart McMillan to be followed by Gillian Mackay.
Thank you, Presiding Officer. Can the Minister provide an assurance that abstinence-based rehabilitation centres operated via religious organisations will also qualify for funding to help provide increased choice for people seeking assistance? Minister.
Presiding Officer, faith-based residential services are included in the scope of residential rehab funding. Obviously, in terms of transparency and accountability, there needs to be clarity about how faith informs the model of care, and we would expect all providers to be equal opportunity providers. But I value the role of the faith communities in terms of service provision, and I also think there's a role for faith communities in terms of winning hearts and minds.
Gillian Mackay to be followed by Brian Whittle.
Thank you, Deputy Presiding Officer. The Minister mentioned the interaction between stigma and medical-assisted treatment in her statement. I appreciate the detail of the stigma strategy is probably too much to go into here, but in practical terms, could I ask what work is underway to directly engage with those who would benefit from medical-assisted treatment, and particularly those who may suffer with multiple stigma?
Minister.
Presiding Officer, perhaps I can point to the fact that in terms of the media campaign that's aimed at tackling stigma, that was carefully developed over a not inconsiderable period of time with people with lived and living experience. I think as we go forward with the national mission, I think there is more to do to address the stigma that people in the workforce feel, and there is more to do to address the stigma that families and communities are adversely affected by too.
Thank you. Brian Whittle to be followed by Audrey Nicholl.
Thank you, Deputy Presiding Officer. I think the Minister obviously initially quite rightly focuses on preventing death in the most acute drug addiction cases, but there is also a need to prevent people from falling into that position in the first place. Does the Minister agree that we need to coordinate our resources, use that data to deploy them in the most effective manner, including a greater integration between statutory and third sector services? I should be aware of my view on funding the third sector effectively.
Minister.
Presiding Officer, I hope that Mr Whittle is well aware of my view that we absolutely have to have an acute focus on prevention and education, and we do, and that I hope he is aware of my views of the value and the role and the potential of the third sector in this country, and that's why there have been funds of £11 million announced this year.
Thank you. And Audrey Nicholl.
Thank you, Presiding Officer. I welcome the Minister's announcement this afternoon, and she will know that the Criminal Justice Committee has been taking evidence on the challenges faced by people previously accessing drug services and who are now in prison. In our recent pre-budget scrutiny work, committee members recommended, among other things, investment in recovery cafes in prisons. So can I ask the Minister to what extent the action she's outlined today will support the ongoing work by the Scottish Prison Service to respond more effectively to prisoners with a drug dependency, and will there be the injection of funds in the recovery cafes that the committee asked for?
So again, Presiding Officer, I would point to the funds that are available to the third sector in this regard. I have visited recovery cafes, most recently at Perth Prison. I've recently met the Addywell Recovery Cafe at the recent annual recovery walk, and the MAT implementation support team is very focused in working with the National Prison Care Network as well to ensure that access to MAT is not compromised, and that people within prison have the same access to MAT standards. But I'm very much in support of recovery cafes. We fund organisations such as the Scottish Recovery Consortium and Cisco, Sustainable Intervention Support and Change Outside, to carry recovery work in prisons, and that they bring that lived experience from local recovery communities into prisons to provide things like peer mentoring support, and they're very valuable indeed.
Thank you very much, and apologies to Monica Lennon for not being able to call it. Point of order, Stuart McMillan.
Thank you, Presiding Officer. I apologise to the Chamber. I omitted to remind the Chamber of my declaration of interest as a board member of Moving On Inverclyde, which is not a faith-based organisation.
Thank you, Mr McMillan. That is now on the record. There will be a short pause as the front benches change. Okay, the next item of business is a statement by Shirley-Ann Somerville on recovery and improvement in schools and early learning. As ever, the Cabinet Secretary will take questions at the end of our statement, so there should be no interventions or interruptions. And I call on the Cabinet Secretary for around 10 minutes, please.
Thank you very much, Presiding Officer. As the First Minister said earlier, I want to stress again our focus on the well-being and learning of children and young people during this challenging period. We know Omicron is a serious threat and we need to do all we can to ensure schools and early year settings can stay open with as little disruption as possible. And I would like to start by thanking all of those involved in Scottish education for their ongoing work: school leaders, teachers, school support staff, children, young people, their carers and families, all of whom have made sure that learning continues despite COVID-19. Today's publication of the Achievement of Curriculum for Excellence Levels data, or ACEL, shows many young people succeeding in gaining fundamental educational blocks despite the interruptions in their schooling forced upon them by the pandemic. However, it also shows an exceptionally disappointing but unfortunately not unexpected overall drop in attainment in literacy and numeracy amongst primary school learners in 2020-21. This is not an issue unique to Scotland. Worldwide, education has been impacted. Our own equity audit, published earlier this year, highlighted the impact of the pandemic, particularly on those affected by poverty. Last week, Ofsted's Chief Inspector's annual report noted nearly all children and learners have been affected by the pandemic. And a recent report from the World Bank documents evidence of pandemic-related learning loss over 28 countries at all income levels. I reaffirm today my government's commitment to delivering excellence and equity in education. Before the pandemic, the year-on-year trend in the ACEL data was positive. Our education system was making progress in response to the focus on improvement, and we are building on that with our publication today of the National Improvement Framework and National Improvement Plan. We are demonstrating our long-term commitment to this approach to the education system. New initiatives build on earlier and learning from what works and what teachers, schools and young people tell us that they need. As part of this learning process, we have amended the National Improvement Framework's vision, priorities and drivers this year to better articulate the centrality of children and young people, their voice and their rights. We have increased our emphasis on early learning and childcare to reflect the importance of the early years in children's learning and preparedness to learn. The National Improvement Framework and National Improvement Plan underpin our long-term plans, and it is right we reaffirm our commitment to a mission that began before COVID and will continue when it leaves us. But we recognise that COVID-19 has changed everything. That is why we have already committed to £500 million worth to support education since the start of the pandemic. Local authorities were asked to target this funding towards well-being, literacy and numeracy, support for families and support for attendance or engagement with learning. Local authorities and schools worked together to ensure support was available where it was needed. And as children began their phased return to in-person schooling in the spring, we asked schools to focus on their well-being first. Children cannot learn well if they do not feel well. Schools have responded innovatively. Across Scotland, they use digital platforms, including Glow, the National e-learning offer and others, supplemented with on- and offline resources and targeted intervention for key areas of the curriculum, including literacy, numeracy and well-being, to maximise support to children and to young people. Given our concern that COVID would impact negatively on education, this Government has already put in place policies to support the education system to support learners. The Education Recovery Strategy drew these together, aimed at closing the gap created by the pandemic. We are providing further support for learners who are sitting exams in 2022, ensuring access to in-school mental health and wellbeing support that young people need, expanding funding for early learning and childcare, recommitting to the tackling the poverty-related attainment gap and recruiting additional teachers and support staff. On top of the 1,400 teachers recruited in 2020-21, we have committed to bring a further 3,500 teachers and 500 support staff into the system by the end of this Parliament. The school census data published today shows that in September we already had over 2,000 more teachers in the system than before the pandemic. We provided £240 million of investment for these staff, and Thursday's budget set out how we are supporting their retention with a further £145.5 million per year from 2022-23. These additional staff bring the ratio of pupils to teachers to 13.2, its lowest since 2009, directly supporting children by increasing the amount of teacher attention available to each child. This is a powerful injection of resource, providing additional support to the system while COVID is still causing staff absences. It is supporting schools to help children and young people whose education has been most affected by the pandemic to regain their confidence and build their skills. Once the effects of the pandemic are less, this increase in staff will support improvements in attainment. It matters just as much that teachers in our classrooms are highly skilled and well supported in their ongoing professional development. Our commitment to reducing class contact time for teachers by 90 minutes per week will help facilitate teachers' access to extended professional learning and collaborative planning opportunities. We would hope to have this in place for August 2022. However, the timing of this change will be determined by the Scottish Negotiating Committee for Teachers, and we will be dependent on capacity in the system. I am grateful to them for working with us on these changes. I noted in my statement on the Scottish Attainment Challenge on the 23rd of November that the pandemic is likely to have impacted the poverty-related attainment gap. We are determined to focus our resources on supporting the attainment and life chances of children and young people most impacted by poverty. We are investing £1 billion in targeted funding over the course of this Parliament, up from £750 million in the last Parliament, with up to £200 million distributed for 22-23. We have already delivered on our first 100 days target to ensure that the first instalment of that funding this year, alongside the £20 million People Equity Premium, is there for local authorities. Further, we are determined to reduce variation in educational outcomes in different parts of the country. Variation reflecting responsiveness to the needs of children and young people in different communities, using assets available in different places, is a good thing. It can mean local professionals are responding creatively and imaginatively to different circumstances and needs. Variation where children from different areas are disadvantaged in their life chances is not acceptable. Education is central to improving the opportunities of our young people, and we must support schools to ensure that they do that for all pupils. I have already announced plans working with partners across education to develop a framework for recovery and accelerated progress, which we will publish in the new year. Planning and reporting will be streamlined to enable us to understand what schools and local authorities expect to achieve and by when, using local stretch aims. Schools and local authorities will set out their ambitions for improvement using local knowledge and professional expertise. In government, we will work with partners to develop the national picture in terms of pace of expected progress later in the year. Today's revised National Improvement Framework and the National Improvement Plan for 2022 responds to the recommendations set out in this year's reports from the OECD, Audit Scotland and the International Council of Education Advisors. Key improvement activity includes the ongoing provision of professional learning and leadership opportunities, enhancement to teacher empowerment and the expansion of Education Scotland and local authority joint work on collaborative improvement. Despite the ongoing challenges of COVID-19, it is right we maintain our focus on future improvements. In 2022, a subgroup of the Curriculum and Assessment Board will consider how to better understand children and young people's achievements across all the 4 capacities of the Curriculum for Excellence as successful learners, confident individuals, responsible citizens and effective contributors. The group will consider whether a sample-based survey can add value to our understanding of progress. We will also carry out a consultation exercise early in 2022 to review the key measures in the National Improvement Framework. We remain committed to teacher judgment as the primary means of assessing progress in the broad general education. National standardised assessments being delivered this year, in the highest number since introduction, continue to play an important role in supporting teacher judgment. Local authorities have strategies in place to improve aspects of education. Local plans have been analysed by Education Scotland and inform the 2022 National Improvement Framework and Improvement Plan. Improving literacy and numeracy is also already a common feature of this work undertaken by a number of regional improvement collaboratives. I know local government is also mindful of the recommendations in the Audit Scotland report focused on tackling variation and the need for locally driven improvement activity. It is, of course, the role of Education Scotland to support local improvement through national initiatives. They provide support at universal, targeted and intensive levels and continue to work with the regional improvement collaboratives and local authorities to identify and implement interventions to improve outcomes for children and young people. We must pull together around those who have felt the pandemic hardest, focusing resource where evidence shows the impact has been the most extreme. I have therefore asked Education Scotland to engage directly with authorities who have experienced the biggest falls in attainment to support them in planning interventions with the greatest opportunity for success. Scotland already has the National Response to Improving Mathematics Partnership Board, and we will set up a National Response to Improving Literacy group. Both groups will examine the existing landscape in Scotland and internationally, seeking opportunities to enhance professional learning for teachers and the classroom experiences for young people. In the light of today's attainment data, I will be asking both groups to develop evidence-based recommendations in spring 2022 with a view to implementing changes as soon as possible. This has been a turbulent 20 months and the pandemic continues to bring new challenges. Every person working in schools and services for children and young people is dealing with the impact of the pandemic on themselves and their families, while also supporting the children in their care and continuing to support their learning. As we go into another difficult winter, I do not underestimate the level of personal commitment, integrity and energy that takes, and I want to thank teachers, early learning and childcare practitioners and other education staff for all they continue to do. Despite new and ongoing challenges of COVID, we remain determined to make sure schools, and through them our children and young people, have the support they need now, taking opportunities and building the foundations for further improvement as we move forward. Thank you.
Thank you. The Cabinet Secretary will now take questions on the issues raised in her statement. I intend to allow around 20 minutes for questions, after which we'll need to move to the next item of business. As ever, it would be helpful if members who want to ask a question could press the request to speak buttons as soon as possible or place an R in the chat function. And I call on Oliver Mundell.
Thank you, Presiding Officer. These shocking results reveal the brutal impact on young people of COVID, which has been heightened by years of SNP failure. Scotland's schools came into the pandemic unprepared after 14 years of the SNP letting standards slip. The double whammy of COVID and the SNP's botched reforms have sent the attainment gap between the richest and poorest pupils spiralling to its worst ever level. These grim statistics show that despite the best efforts of teachers and parents, pupils across Scotland are not reaching the expected levels of attainment in reading, writing, numeracy, literacy and listening and talking. Dreadful results on this scale should shame Nicola Sturgeon. She promised to close the attainment gap, but instead it's wider than ever. Education has never been her top priority, and it shows. This SNP government have let down our children and young people. Cabinet Secretary, are you ready to admit that it was a mistake to deny the need for catch-up plans for our young people? And will you say sorry for failing, then abandoning this generation of pupils?
Through the Chair, but Cabinet Secretary.
Well, I fully and readily accept that these are exceptionally disappointing figures, but they are not unexpected, unfortunately, given the fact that we are in a global pandemic. And I did raise in my statement some of the examples of how this is also impacting on England and indeed further afield. And I think that context is exceptionally important. The one part I would absolutely agree with Oliver Mundell on is the work that's happened within our schools to support children and young people from teachers and support staff has been truly exceptional under the most difficult of circumstances. And this government has supported them to the best of our abilities during the pandemic, as I said, with £500 million worth of support as we went through the pandemic for a number of areas, not just, but very specifically teacher numbers as an example. So we will continue to ensure that we are taking action on this, including on teacher numbers. And what we will also do is ensure we continue to empower teachers to make the decisions at a local level about what's right for them. That's why the Attainment Fund is so important. That's why the Pupil-to Equity Fund is so important, because we are committed not to a top-down approach from here, but to provide the resource to be able to provide schools with the ability to take the decisions that's right for them.
Michael Mara.
Thank you, Presiding Officer, and I thank the Cabinet Secretary for advance sight of her statement. I'd like to associate Labour's and the Labour Party's sentiments with what the Cabinet Secretary says about a thanks to give to teachers and education staff across Scotland, to parents and to pupils. The Cabinet Secretary is right in saying these statistics are not surprising, but they are shocking and they are hugely problematic for this country. We may, I believe, and we do disagree on the actions this government has taken in the pandemic, whether they've been sufficient and the record of the last 14 years. But surely we can agree that these figures today tell us that more of the same cannot be tolerated. It's insufficient just to ameliorate, undo the cuts of this government, given the unprecedented level of the scale of the challenge that we now face. Unless we see the necessary reaction and a resolve that the young people of Scotland will not now bear the scars of this pandemic, then these numbers will represent the diminished life chances of a generation. It's that stark. We must give them opportunity and the resource they need and the hope that they require. Can I ask the Cabinet Secretary, will the Government commit to urgent analysis to assess the full impact of the pandemic on education, and so it can tell us what action is required to save this situation? What further action will be taken to ensure the recruitment of extra teachers now, not over the next 5 years, but now? And will the Government reverse the cuts it made to the Scottish Attainment Challenge funding in the budget last week, as that resource has never been more needed?
Cabinet Secretary.
Well, what I said in my statement in November on the Scottish Attainment Challenge is that the money over this parliamentary term has increased from £750 million to £1 billion, and that is part of our response to the pandemic, because we have unfortunately been expecting disappointing, exceptionally disappointing statistics such as these, although of course up until now we have not seen the full impact of those. I think the evidence today is part of the demonstration of the impact on that, as has some of the recent analysis on the health and well-being of our young people when we're looking at mental health. What I again would, and I will try to seek consensus wherever I can on this, is I would agree with Michael Mara that absolutely the young people of today should not bear the scars of this pandemic. The work of the Scottish Government to ensure that that does not happen has been quite clear for some time. I would point, for example, to the Young Persons Guarantee for those that are moving out of schooling. But I would point again specifically to the work that we're doing to increase teacher recruitment and to increase the attainment funding to demonstrate that. And we are already making great strides in the number of teachers. The teacher census, which has came out today, does point to more than 2,000 more teachers now than in 2019. That's more teachers now than at any time since 2008. And we are fulfilling on our commitments that we had in the first 100 days to ensure that we are providing local authorities with the funding that they require to make sure that they recruit, because it is them that are the employers, that they recruit the teachers that we so desperately need. And I would expect them, and I'm sure they will follow up on that.
Okay. Cocag Stewart, who joins us remotely, to be followed by Megan Gallagher.
Thank you, Presiding Officer. The Scottish Government is investing in teacher recruitment, with the biggest increase in investment since 2007 unveiled in the budget last week. Summary statistics for schools in Scotland 2021, published today, shows this investment paying off, with the pupil-teacher ratio at its lowest since 2009. Can the Cabinet Secretary set out the importance of this in driving recovery in our education system?
Cabinet Secretary.
Well, CoCAB is quite right to point to the significant and sustained injection of teaching resource that's providing additional support to the system while the pandemic is still causing staff absences, as well as supporting schools to help children and young people whose education has most been impacted by the pandemic. As she rightly points out, these additional staff have also brought the ratio of pupil to teachers to the lowest it has been since 2019, and that's obviously directly supporting children by increasing the amount of teacher attention available to each child. This, of course, will ensure, once that work is in place as it is, that we will have our commitment to 3,500 additional teachers and 500 classroom assistants by the end of this Parliament, ensuring that the work is sustained.
Okay, as well as reminding colleagues to turn their phones off or on silent while they're in the chamber, can I ask for succinct questions and succinct answers so that we can get all through the questioners within the time available? Megan Gallagher to be followed by Bob Doris.
Thank you, Presiding Officer. The Cabinet Secretary outlined the Scottish Government's intention to reduce class contact time for teachers by 90 minutes per week. As school closures are still taking place due to the ongoing pandemic, this could impact young people being able to catch up on lost schooling. Given that 99% of teachers did not believe their pupils were fully engaged with homeschooling during the height of the pandemic, does the Cabinet Secretary share my concerns that this is not the appropriate time to be cutting class time between teachers and young people?
Cabinet Secretary.
I genuinely think Megan Gallagher is missing the point on this one, Presiding Officer. I said in my statement that there is the intention to bring this in by August 22, but we will work with the SNCT to ensure that there is capacity in the system to allow that to happen, and particularly to ensure that we are providing young people with the support they need. There is absolutely no suggestion that the Scottish Government will do something that will actually diminish the number of teachers or the amount of time that we have within the school system until the system is ready. But that's exactly why we are working very hard to recruit more teachers into the process to ensure that that can happen.
Bob Doris to be followed by Martin Whitfield.
Thank you very much, Presiding Officer. I want to place in the record my thanks for teachers and staff in Glasgow for their hard work and the success that has been demonstrated in these stats released today. That said, achievement for curriculum for excellence levels data published today shows wide variation in local authority performance, including with comparative quintile deprivation levels also. Can I ask the Cabinet Secretary to set out what lessons we can learn from this, and more importantly, what steps she will take to improve the situation?
Cabinet Secretary.
Well, this is a very important issue, and it was an issue before the pandemic, and something that we are determined to take further action on. Mr Doris will be well aware that the Refresh Scottish Attainment Challenge programme aims to increase the pace of progress and, very importantly, to tackle the variation that he spoke about. This has been a stubborn feature in Scottish education for too many years. So we are right to look right across the system. We have a shared objective on this with local government to develop a framework to support recovery and accelerate progress. That will see better collaboration, greater support, greater challenge where necessary across all parts of the education system, and see planning for tackling the poverty-related attainment gap streamlined with the identification of the local stretch aims, which I mentioned in my statement. That will be a key area to seek to reduce the variation that Mr Doris mentioned in his question.
Martin Whitfield to be followed by Stephanie Callaghan.
I'm very grateful, Deputy Presiding Officer. Reaffirm, better articulate, increase our emphasis, already put in place, drew together, already delivered, have already announced. Given the agreed urgency of the situation, what is new in this statement that will narrow the attainment gap?
Cabinet Secretary.
Well, I mentioned some of the measures in my statement. There wasn't time to go into all of them, but I'm sure Mr Whitfield will read the National Improvement Framework now that it is published. But what I would also say is that we have known for some time, and again I pointed to this in my statement, through the equity audit, that we would have disappointing results. We knew this was a challenge that all the education systems were going to face. That's exactly why we have already not just been planning, but taken action on this, because I think I would be criticised, quite rightly, Presiding Officer, if I stood up today and suddenly announced a great detail of new announcements because we hadn't done anything up to this point. We have been taking action, and that's exactly what we will intend to keep doing.
Stephanie Callaghan, who joins us remotely, to be followed by Willie Rennie.
Thank you. Presiding Officer, the statistics on achievement of curriculum for excellence levels show the attainment gap has widened during the pandemic. Can the Cabinet Secretary explain how changes to the design of the Scottish Attainment Challenge will support the efforts to tackle the attainment gap across Scotland over the course of this Parliament?
Cabinet Secretary.
Well, the support of the £1 billion over this parliamentary term for the Refreshed Scottish Attainment Challenge will continue the empowerment that we have seen for school leaders, which is an exceptionally important part of the funding. That's, of course, through that pupil equity stream. That will ensure that we're supporting head teachers to implement evidence-based approaches to meet the needs of children and young people that have been impacted, and importantly for them to do so under local context. Additionally, we have recognised that the impact of poverty and the pandemic is in every local authority area across Scotland, and that's why we have chosen to distribute funding to all 32 local authorities to implement strategic approaches to tackle the poverty-related attainment gap, a change that was, of course, supported by COSLA.
Willie Rennie to be followed by Fulton McGregor.
The Cabinet Secretary protested a little bit too much in response to Martin Whitfield. The truth is that today's statement is just as uninspiring as the Education Recovery Plan earlier this year. There's not much new. What do schools get from this statement today? A new subgroup, a consultation and the threat of a discussion with Education Scotland. Does the Education Secretary really believe that this is going to be enough to tackle the widest and worst poverty-related attainment gap on record?
Cabinet Secretary.
Well, what schools already have is the 2,000 more teachers that have been demonstrated in the school census. That's what came out tonight. What schools already have is the commitment that we've already given over the £1 billion worth of funding that will go into the Scottish Attainment Challenge. That's increased from £750 million. So we have taken action. We will continue to take action. We know there is a great deal that we need to do to be able to support our children and young people. And yes, Education Scotland will play a very important role supporting schools and supporting teachers through that process.
Fulton McGregor, who joins us remotely, to be followed by Ross Greer.
Thank you, Presiding Officer. Can I ask the Cabinet Secretary what measures the Scottish Government are taking to expand early learning care, and can she reiterate how she thinks that this will aid in her overall education recovery?
Cabinet Secretary.
Well, it is very important that we continue to look at early learning. It's a very, very important area that the Government has given a great deal of focus on during the previous session. We have seen, I think, the impact that that's had on families during the pandemic, and of course we have our commitment to ensure that we will expand that to 1- and 2-year-olds during this parliamentary session. That's a commitment that I'm very, very proud that we will deliver on, just as we delivered on the 1140 hours successfully. And our determination to have early learning and childcare as an integral part of that is, I think, demonstrated in its position within the NIF that's published today.
Ross Greer to be followed by Liz Smith.
Thank you. Tackling the causes of poverty and reducing the unnecessary administrative burden on teachers will be key to closing the attainment gap. So can I ask the Cabinet Secretary what progress is being made against two important initiatives? Firstly, the production of statutory guidance to cap the cost of school uniforms, and secondly, the review into the role of indicators and measures in the curriculum for excellence, whose objective is to reduce unnecessary bureaucratic burdens on staff.
Cabinet Secretary.
We're very pleased to work with my colleague in the Scottish Greens to ensure that we are moving forward on our commitment on school uniform. He's quite right to point out that we are looking to see how that can be done on a statutory basis, but what also can we do in the interim to make sure we're making a real difference to children and families and right across Scotland. And I'll be happy to work with him and indeed others who wish to contribute to that. He also quite rightly points out to the need to ensure that we look at the data that we gather, to ensure that we're gathering the right data in the right way. I mentioned part of that in my statement around the work that's happening on the collection of data, but would of course be happy to keep Mr Greer updated on that issue.
Thank you. Liz Smith to be followed by Willie Coffey.
Thank you. Cabinet Secretary, this chamber is absolutely united on the fact that one of the most important aspects of well-being would be to ensure that more children have access to outdoor education. Can I ask the Cabinet Secretary why that did not feature in her recovery plan, And what is the Scottish Government actually doing to ensure that there is more support for the outdoor education centres and their incredible staff within them?
Cabinet Secretary.
Well, can I first pay tribute to Liz Smith for her continued support of the outdoor education sector and her determination to ensure that the Government does all it needs to do on this issue. Outdoor education absolutely remains a critical part of the Government's education plans. We have seen further developments over the last parliamentary session on that, and it absolutely remains a core commitment for us to continue with that and to see what we can do to further expand it.
Thank you. And Willie Coffey.
Thank you. Throughout the pandemic, there has been significant disruption to education here in Scotland, across the UK and the world. And it's clear we're not at the end of this. Could the Cabinet Secretary outline what lessons we have learned and outline what steps are being taken to improve matters?
Cabinet Secretary.
Well, our Education Recovery Plan that was published in October sets out our ongoing response to the impacts of the pandemic and education and some of the important next steps that we will take. The plan draws on studies from our equity audit, which I mentioned earlier, and also, of course, from the reports from the International Council of Education Advisors. And very importantly within that includes that international context. It does ensure that we set out how we should invest the additional funding that we are putting in to support education recovery, and I think that is further demonstrated in the detail of the National Improvement Framework and Improvement Plan that builds on the advice we've had from the International Council of Advisors to make sure we can learn all the lessons that we can from the past few years.
Thank you very much, Cabinet Secretary. That concludes this item of business. There will be a brief pause before we move to the next item of business.
Thank you. Can I remind members of the COVID-related measures that are in place and that face covering should be worn when moving around the Chamber and across the Holyrood campus. The next item of business is a statement by John Swinney on COVID-19 public inquiry. The Cabinet Secretary will take questions at the end of his statement, and so there should be no interventions or interruptions. I call on John Swinney, Cabinet Secretary. Around 10 minutes, please.
Presiding Officer, today I am announcing to Parliament the establishment of a statutory inquiry under the Inquiries Act 2005 to examine the handling of the COVID-19 pandemic in Scotland. At the outset of this statement, I acknowledge that COVID-19 has had and continues to have an enormous damaging impact on our society. And most painful of all, COVID-19 has led to significant loss of life, resulting in heartache to all those who have lost loved ones. We remember all those who have lost their lives, and I express my sympathy to those who mourn their loss. I hope this inquiry will help to provide the answers for which these individuals search. In this statement, I will outline the scope of the inquiry and inform Parliament about the appointment of a chair to lead it. To begin, I want to take a moment to recall why we are establishing a public inquiry. The emergence of the Omicron variant is a stark reminder to us all that this pandemic continues to evolve and challenge us. But that does not mean that we can delay our efforts to learn from the past. Indeed, it underlines the importance and urgency of learning lessons from what has gone before. The purpose of this inquiry is twofold. It is to provide scrutiny and answers to the questions that people have about how this pandemic has been handled in Scotland. Equally, it is to learn lessons so that we can be as ready as possible to respond to future pandemics. It is in that spirit that this public inquiry is being established, and it is how we expect it to continue, to provide answers and to help us make improvements for the future. At this point, I want to express my heartfelt thanks to everyone who has played a part in responding to the pandemic, whether on the front line in hospitals and care, in keeping shops and businesses going, at home finding new ways to work, in taking the vaccine and help protect people around about you. Responding to this pandemic has taken a lot from people across Scotland, and I want to thank every individual who has played their part. In developing the terms of reference for this COVID-19 inquiry, it has been a key priority for the Scottish Government to listen to those who have been affected by the pandemic, to understand what they wish for the inquiry to focus on, while recognising the need to establish the inquiry quickly. This includes, first and foremost, those who have endured the ultimate loss, bereaved families of partners, parents, children, sisters, brothers, as well as people who have lost friends and colleagues. Every life lost is one too many, and my condolences go to all those who have suffered losses and hardship. It also includes wider groups of people who have been affected, whether carers, people working in health and social care, councils, businesses or community organisations. We have also taken care to listen to equality and human rights groups. In the course of establishing this inquiry, we have taken over 400 written submissions and received more than 80 online ideas and nearly 200 comments through an online dialogue challenge. We have met with more than 70 stakeholders from the third sector, the private sector and the public sector. The feedback we have received has been considered carefully by the Scottish Government and captured in an engagement analysis report which we are also publishing today. The feedback from people affected by the pandemic has been key in developing the terms of reference that I am sharing with Parliament today. This includes, not least, strong public support for an inquiry with human rights at its heart. Matters that people have raised have fed directly into the development of the scope of the inquiry. I want to thank everyone who has contributed their thoughts during this process. I know that for many, this will have not been an easy thing to do. The terms of reference for the inquiry set out 12 areas of investigation, each covering a strategic element of the handling of the pandemic. These are as follows: pandemic planning and exercises carried out by the Scottish Government, the decision to lock down and to apply other restrictions, the delivery of a system of testing, outbreak management and self-isolation, the design and delivery of a vaccination strategy, the supply, distribution and use of personal protective equipment, the requirement for shielding and associated assistance programmes provided or supported by public agencies. In care and nursing homes, the transfer of residents to or from homes, treatment and care of residents, restrictions on visiting, infection prevention and control, changes to inspections. The provision of healthcare services, including the management and support of staff. The delivery of end-of-life care and the use of do not attempt cardiopulmonary resuscitation decisions. Welfare assistance programmes, for example those relating to benefits or the provision of food provided or supported by public agencies. The delivery of education and certification, and financial support and guidance given to businesses and the self-employed, including in relation to identification of key workers by public agencies. In investigating those 12 strategic elements, the terms of reference further ask the Chair to consider the impacts of handling of the pandemic on the exercise of convention rights and to create a full factual record of the key strategic elements of the handling of the pandemic. With the exception of the investigation of pandemic planning, the period covered by the inquiry will be from the 1st of January 2020 to the 31st of December 2022. The Chair is asked to identify lessons and implications for the future and to provide recommendations, providing reports to Scottish Ministers as soon as practicable. As I stand here, I am keenly aware of a fundamental challenge of striking the right balance between, on the one hand, addressing the wide range of questions that so many people have, and on the other, making sure that this inquiry can be delivered at speed so we can learn and benefit from lessons as early as possible. To this effect, I have agreed with the Chair that as they begin their work, they will reflect on the terms of reference and suggest adjustments should they wish to. If Ministers then agree any changes to the terms of reference, I will undertake to inform Parliament as soon as possible. This includes adjustments to take into account the remit of the United Kingdom-wide public inquiry that the UK Government has undertaken to establish, as well as any issues arising in the ongoing pandemic, which the inquiry judges to be important to investigate. We remain committed to working with the United Kingdom Government to develop the approach to the UK-wide inquiry and expect the Chair of the Scottish Public Inquiry to coordinate with the Chair of the UK-wide inquiry. The full text of the terms of reference is available on the Scottish Government website as of now. Over the past few months, ministers have been in discussions with the Lord President of the Court of Session to find a suitable chair for the inquiry, in line with our commitment to have the inquiry led by a judge. I would like to express my thanks to the Lord President for his cooperation on this issue. Today, I am pleased to announce to Parliament that the Honourable Lady Poole has agreed to chair the Scottish COVID-19 inquiry. Lady Poole is a sitting senator of the College of Justice of Scotland and has also sat as a judge in the Upper Tribunal of the United Kingdom. From my own and the First Minister's interactions with Lady Poole, I am left with no doubt that Lady Poole is highly qualified for the demanding task put in front of her. I believe she will bring pace and energy to the work of the inquiry, as well as a cool, calm head, and that she will approach experiences of the pandemic sensitively and sympathetically. I am satisfied that Lady Poole possesses the leadership skills, integrity and deep technical knowledge to undertake this inquiry. Of crucial importance, I note in particular Lady Poole's high degree of expertise in administrative law and human rights law, which is exactly in line with the expectations we have that the inquiry should take a human rights-based approach. And I should say that Lady Poole has also made clear to the First Minister and to me her own conviction that human rights and equalities should be addressed as part of the inquiry and in the way the inquiry is run. I am convinced that Lady Poole will approach the inquiry in such a manner as to do justice to those who have suffered through this pandemic and to make sure we learn the lessons we need to learn so Scotland is prepared for the next pandemic. No panel members will be appointed today. It will be for the Chair to decide whether to appoint any assessors to provide expertise on particular subjects or any other assistance to the inquiry. In the coming period, the Chair of the inquiry will make necessary preparations on operational matters, including the appointment of the inquiry's key staff. Once set up, the inquiry will make announcements about its approach and progress as the Chair sees fit. I extend my thanks to Lady Poole for being prepared to take on this most important challenge on behalf of the people of Scotland. We all need the inquiry to explore the handling of the pandemic and to identify the lessons we all need to learn. I pledge that the Scottish Government will engage, as I know this Parliament and everyone in Scotland will, to support Lady Poole in this most important task that she now takes forward on behalf of us all.
Thank you. The Cabinet Secretary will now take questions on the issues raised in his statement, and I intend to allow around 20 minutes for questions, after which time we will move on to the next item of business. It would be helpful if those members who wish to ask a question were to press the request to speak buttons now, and I call Murdo Fraser.
Thank you. Deputy First Minister, can I thank the Cabinet Secretary for his statement and for advance sight of it? And can I welcome the establishment of the inquiry being announced today? It will be particularly welcomed by the relatives of those who tragically lost their lives in care homes to COVID, who have been waiting patiently for this process to begin. And can I also welcome the appointment of Lady Poole as inquiry chair, with her focus on human rights and equalities. I have two questions to ask today of the Deputy First Minister. Firstly, those who lost loved ones want answers as to what went wrong. They also want to know when they are likely to get those answers. And the Deputy First Minister said this process would be conducted at speed. I appreciate this may not be an easy question for him to answer, but I think it would be helpful if he gave us an indication of when he might expect Lady Poole to report on her findings. I think the relatives would welcome that. Secondly, the Deputy First Minister will be aware of concerns we expressed about the report by Public Health Scotland on COVID deaths in care homes up to February not being published as scheduled because of the Holyrood elections in May. Can we have an assurance from the Deputy First Minister that the Scottish Government will cooperate fully with the inquiry and make all necessary information available to it as quickly as possible.
Cabinet Secretary.
Presiding Officer, on the first question that Mr Fraser asked me, he's absolutely right. It's a difficult question for me to answer. There are different ways in which public inquiries can take forward their reporting responsibilities. It will be for Lady Poole to determine how she does that. But if I give Mr Fraser an example, Lady Smith in the Historic Child Abuse Inquiry has published a series of case study findings in the course of her report, of her work. I think that has been very helpful in giving answers to individuals who have experienced abuse in those circumstances. And I hope that the way in which we have structured the remit of the inquiry on COVID perhaps gives the opportunity for Lady Poole to consider whether there is an interim set of conclusions that she could publish on a similar case study basis. But that is, of course, me intruding on the design of the inquiry, which I am not entitled to do. So we obviously want a report as quickly as possible, or we want findings as quickly as possible, but clearly there has to be adequate time to undertake these tasks. But I'm sure Lady Poole will make clear her approach to this point in due course. In relation to Mr Fraser's second point, I would dispute the narrative that he sets out, but I assure him that the Scottish Government will cooperate fully with the inquiry. Indeed, I've given a pledge to do so, and the Government will do that in every way that is required to do so.
I call Jackie Bailey.
Can I thank the Deputy First Minister for an advance copy of his statement, and I too welcome the announcement that the Honourable Lady Poole will preside over the public inquiry. It is important that we don't wait to learn lessons from the initial decisions around the pandemic to inform thinking as quickly as possible. So on that basis, can the Deputy First Minister maybe indicate when the inquiry will start? The previous Cabinet Secretary for Health set out the 4 harms that would be considered by the public inquiry, and I'm pleased to see that these are reflected in the remit. It is right that some of the focus will be on deaths in care homes, which were at the very epicentre of the pandemic, and decisions by Scottish ministers to discharge people from hospital without testing. It will also examine the non-COVID health impacts, and today the National Records Office told us that the number of deaths for non-COVID related reasons has increased. The number of deaths in quarters 1, 2 and 3 all higher than the previous 5-year average, up by 15% alone in the last quarter. Cancer deaths are up, coronary heart disease deaths are up, deaths from dementia and Alzheimer's were also up. So can the Deputy First Minister confirm that item H of the remit will encompass looking at whether decisions to cancel cancer screening programmes, delays in diagnosis and the cancellation of operations that perhaps contributed to this higher than normal death toll amongst the population will be fully considered?
Cabinet Secretary.
So the formal process of the establishment of the inquiry requires there to be a setting date established, which will be as early in the new year as we can arrange, and that essentially is a matter of negotiation between the Government and Lady Poole, with Lady Poole very much in the driving seat of determining that moment. So we will get the inquiry established so that it can then begin its proceedings. We've taken a very significant step to get to the appointment of a chair. A terms of reference, interim staff are in place to support Lady Poole, and she will be able to make steps, and I know wishes to proceed at pace to establish the inquiry. In relation to the wider questions, many of the issues that Jackie Bailey raised are frankly matters for the inquiry to consider. There are at the heart of the handling of COVID has been the 4 harms framework. It was a policy development which I led within government to recognise the fact that there are no easy choices to be made in the handling of the COVID pandemic, and I acknowledge there have been significant implications for other health services as a consequence of the prioritisation of COVID care. Sadly, that is what happens when a global pandemic comes upon us. But the inquiry will be able to consider and to reflect all of that thinking in what has been a very broad remit that has been given to the inquiry, and obviously Lady Poole will be able to reflect on all of these questions.
I call Beatrice Wishart, who is joining us remotely.
Thank you, Deputy Presiding Officer. Firstly, I would like to extend my condolences to all those who have lost loved ones to COVID-19. My thoughts are also with those who are living with long COVID. I too thank the Deputy First Minister for sight of his statement, and I'm pleased to hear of and welcome the appointment of Lady Poole as Chair of the Public Inquiry and also of the human rights-based approach. It's important that the actions taken by government during the pandemic are examined so lessons are learned, both good and bad. So it's important that the public inquiry does not take years and years to report and the moment to learn is lost. In the time it can take, memories fade, contemporary evidence is lost and any hope of accountability withers. So can the Deputy First Minister provide an assurance that the voices of all those impacted across health and care, education and the wider community will be at the root of the inquiry? And can I impress on the Deputy First Minister to clarify a timetable so we don't have another Penrose or Chilcot inquiry?
Deputy First Minister.
Presiding Officer, there is always in the timetable of an inquiry the challenge between the need to provide adequate examination of all of the issues involved and the speed of reporting. I know that's an issue that Lady Poole feels very acutely. She has made it clear to me that she does not want to spend the remainder of her judicial career leading this inquiry, and I very much agree with that sentiment. So I think Lady Poole will be determined to make sure the inquiry covers the ground that it has to cover, but it does so efficiently and promptly so we can learn lessons and there can be the understanding and the accountability that Beatrice Wishart properly talks about in that respect. So I cannot at this stage prescribe the timescale, but I do give Parliament the assurance that Lady Poole is keen to make as swift progress as she can, and the Government is very happy to support her in that endeavour.
John Mason, to be followed by Sanjay Gohani.
Thank you very much, and I do welcome the inquiry. But clearly, as the Deputy First Minister said, the pandemic is still evolving, and some people might think it was too early to be having a public inquiry because we cannot look back at the whole thing. So how would they respond to such people?
Deputy First Minister.
Mr Mason is absolutely correct. We've just had a statement that's dominated the afternoon session of Parliament today, which has reflected on the latest challenge that we've had thrown at us from Omicron. 3 weeks ago, the Cabinet had a discussion in which I think it would be generally summed up that we felt that the pandemic was in a relatively stable position. We found ourselves 48 hours later taking a dramatically different view because of the emergence of Omicron. So I think what Mr Mason makes a very fair point, but I think what the Government has to acknowledge is that the public have a desire to ensure that whilst we are dealing with this difficult situation, we are also learning lessons to influence policy making in the future. And that's what the Government is committed to ensuring is the case. And we will cooperate with the inquiry, but at the same time we have to give the attentive focus on ensuring that we manage the pandemic that we currently face. And that's I'm happy to give that assurance to Parliament today.
Sanjay Gohani, to be followed by Kokab Stewart. Dr Gohani is joining us remotely.
Thank you, Deputy Presiding Officer. I only stood for election because I felt there was poor communication between the Scottish Government and the NHS during the pandemic, and so I do welcome this inquiry. Would the Cabinet Secretary give an assurance that we could look at long COVID and we can look at how we have gone about treating patients who suffer from this debilitating condition?
Deputy First Minister.
Well, I think what Parliament will recognise is that I've endeavoured to ensure that we have the broadest possible remit available for the inquiry. I think asking Lady Poole to judge about the treatment mechanisms for long COVID feels to me like a clinical matter, which is perhaps beyond the scope of the inquiry. There are plenty of clinical advisers that can consider the issues around the treatment of long COVID. Lady Poole is free to explore all of the questions that are relevant to the terms of reference. And if there are issues in relation to long COVID which arise, I'm quite sure we will hear about those issues.
Cocab Stewart, to be followed by Pam Duncan-Clancy, and Cocab Stewart is joining us remotely.
Thank you, Presiding Officer. I welcome this public inquiry and I am hopeful that it will be thorough. I would like to ask the Scottish Government how it will ensure that all viewpoints and voices are heard in the public inquiry, specifically the voices of our asylum seeker and refugee population.
Deputy First Minister.
Presiding Officer, there's 2 points I'd make in relation to Cocab Stewart's question. The first is that the inquiry is obviously embarking on its approach with a human rights-based approach, so the interests of different groups within our population is very important that the interests, the perspectives and the experience of different groups in our society are fully considered at the heart of the inquiry, and I'm certain the remit enables that to be the case. The second point I would make is a slightly more constrained point, which is that the inquiry is required by law only to examine Scottish matters. So essentially the implications of Scottish policy decisions on the asylum seeker community would be relevant to be considered. But some of the questions about asylum policy, for example, are reserved issues for the United Kingdom Government, and the inquiry would by law be unable to explore some of these questions.
Pam Duncan-Clancy, to be followed by Stuart McMillan.
Thank you, Deputy Presiding Officer. During the pandemic, social care services stopped overnight for some people. Disabled people were left without help to wash and live in their beds for weeks. This has had a significant impact on their human rights, and it also meant that approximately 400,000 more people have taken on unpaid care, 70% of whom haven't had a break, and most of whom were women. On average, women spent 4.5 hours per day on unpaid work, and the UN has said that it could put women's rights back by 25 years. The impact of decisions taken in social care on disabled people and on unpaid carers and women does not appear specifically in the remit, nor does the unequal impact the decision had on specific groups. Can the Deputy First Minister confirm that these issues are within the remit and the work of the inquiry?
Deputy First Minister.
Presiding Officer, what we've tried to do in the remit of the inquiry is to set out the range of issues to define the broadest possible scope for issues to be considered, and then in the notes on interpretation to set out the basis of so doing, which is fundamentally about the application of convention rights as defined in the Human Rights Act. So we are trying to take right at the heart of the inquiry a human rights-based approach, which clearly involves an assessment of decision-making on questions such as discrimination and about decisions that may have a discriminatory nature about them or implications of a discriminatory nature. So all of these factors are legitimate issues to be considered within the scope of the inquiry.
Stuart McMillan, to be followed by Gillian Mackay.
Thank you, Presiding Officer. Can the Deputy First Minister provide an assurance that the public inquiry will engage with and speak to people from every constituency, with an initial focus at least to those areas that have suffered the greatest from the pandemic?
Deputy First Minister.
I'm not sure if Mr McMillan is putting to me the term constituency in a parliamentary constituency sense or in a grouping within society. I think what's important is that the inquiry has got to reflect the experience of every part of the country. As Mr McMillan will know from the community that he represents, some communities have had much harsher impact as a consequence of some of the underlying issues of inequality that exist in those communities. So these issues will be considered and reflected on right across the whole of the country to ensure that we do adequate justice to the issues that are raised from the different experiences of different parts of the country.
Gillian Mackay, to be followed by Christine Graham.
Thank you, Deputy Presiding Officer. We're still very much in the middle of the pandemic with the development of the Omicron variant. The inquiry obviously cannot wait any longer, so can the Cabinet Secretary outline if the inquiry will provide interim reports to inform scrutiny work and how the ongoing response to Omicron will be examined by the inquiry?
Deputy First Minister.
In relation to the last part of Gillian Mackay's question, obviously the fact that the timescale of the inquiry or the period in scope goes up to the 31st of December 2022, there will be the opportunity to reflect on the experiences in relation to Omicron. In relation to the reporting questions, in my response to Murdo Fraser, I did give the example that there is the opportunity, should the inquiry decide to do so, to take a case study reporting or a series of interim reports. These are choices that Lady Poole will make, and I'm quite sure she will consider the representations that are made in the course of this parliamentary statement and other experiences about how these matters may be best taken forward.
Christine Graham, followed by Brian Whittle.
Thank you, Deputy Presiding Officer. Quite rightly, this is an extensive, in-depth and very welcome inquiry, and I note there are 12 heads. But on the reports, I note that in the statement, Deputy First Minister, you say the Chair is asked to identify lessons and implications for the future and to provide recommendations, providing reports, that's plural, to Scottish ministers as soon as practicable. Am I assuming correctly that the Chair is being asked to identify under specific heads, it will be a matter for the Chair, what matters to report as soon as practicable, in the, like interim reports rather than a full-fledged report for the entire inquiry?
Deputy First Minister.
Yes, the Chair has, the Chair has got scope to consider how best to address the 12 areas of investigation that are at the heart of the terms of reference of the inquiry, and it will be up to Lady Poole to determine how best to hear and to structure evidence to enable that, and then to report accordingly. And those matters would be, I've given, perhaps suggested some more detail than I probably should have in the course of this statement, but it will be for Lady Poole to determine these issues independently of government, and I stress that she will be operating absolutely independently of government.
Brian Whittle, to be followed by Jim Fairley.
Thank you, Deputy Presiding Officer. In light of what the Deputy First Minister has just said there, will the inquiry be allowed to examine the way in which the Scottish Government reported to Parliament and the way in which the Scottish Parliament were permitted to scrutinise Scottish Government decisions? Deputy First Minister.
I think the terms of reference are there. I think my judgment would be that Lady Poole might think that the way in which Parliament scrutinises the government is a matter for members of Parliament, and members of the judiciary tend not to reflect on the processes of Parliament. But I certainly, if that was an issue which was to be considered, that would be, I have no opinion as to whether that should be the case or not. I do think, just for the record, there has been a voluminous amount of parliamentary scrutiny, not least of which my Thursday morning meetings with Mr Whittle and his colleagues.
And Jim Fairley.
Thank you, Presiding Officer. As well as the tragic health impact of COVID and the evident economic impact with the necessary protections, there will be effects that we've still yet to feel. So can the Deputy First Minister outline how the Inquiry Chair will work to identify those areas so that all possible lessons are learned for future pandemics?
Deputy First Minister.
Obviously, by defining a time period which extends to the 31st of December 2022, we expressly acknowledge the point that Mr Fairley is making, that we are still in an evolving situation. It's reflected in the question that Mr Mason put to me as well a moment ago, that we have to recognise that there may well be changes and developments in front of us. And the inquiry has the opportunity to consider and to reflect on those issues and to make recommendations accordingly, and that will be for the inquiry to determine how best to do that. That would be inappropriate for ministers to prescribe that.
Thank you, Deputy First Minister, and that concludes the statement. There will be a short pause to allow front benchers to move seats safely before the next item of business. Thank you. Thank you. The next item of business is a statement by Lorna Slater on Scotland's Deposit Return Scheme. The Minister will take questions at the end of her statement, and so there should be no interventions or interruptions. I call on Minister Lorna Slater. Around 10 minutes, please, Minister.
Thank you, Deputy Presiding Officer.
When I updated Parliament last month, I underlined the Scottish Government's commitment to delivering an operational deposit return scheme as soon as practicably possible. Since then, we have continued to work closely with both Circularity Scotland and industry to agree a final timescale and clear milestones for delivery. Members have also had the opportunity to be briefed by Circularity Scotland on implementation. When Parliament passed legislation to establish deposit return last year, we all hoped that we would be further along the path to introduction than we are. As a result of the pandemic and the uncertainties caused by Brexit, an independent review of the scheme was commissioned, and we have published that today. The review concluded that July 2022 implementation date was not achievable. The likelihood of a July to September 2023 delivery was possible, but with significant risk to achievement. The review also identified the following actions: agreeing a critical path with key stakeholders for delivery of a viable product by the agreed start date, reaching a decision from the UK Government with respect to the VAT treatment of deposits, reviewing the governance structure to reflect the implementation phase and to establish an objective assurance regime aligned with key milestones, work with industry to develop and resolve practical issues to online sales. Since taking up my position as Minister for Circular Economy, I have worked intensively to put the DRS scheme back on track. My background is in engineering project management, and I have made it my priority to develop and agree a project plan to deliver the scheme that I, the industry and stakeholders can have confidence in. Implementing the deposit return scheme is a massive national undertaking, involving contracts with more than 4,000 producers and tens of thousands of return points to manage more than 2 billion containers per annum, with a total turnover of around £500 million. It is essential that this scheme is a success, and not just in the short term, but for decades to come. Taking into account the independent advice we have received and input from stakeholders, I can announce today that the work to implement Scotland's and the UK's first deposit return scheme will conclude with the scheme's launch on the 16th of August 2023. However, work will intensify immediately and, as I will mention shortly, I hope that we will see the scheme in operation on a voluntary basis in some premises before then. Our DRS will be among the most environmentally ambitious and accessible in Europe, including tens of thousands of return points for plastic, metal and glass containers, as well as pickups for online deliveries. Though some have asked for a reduction in scope of the scheme, I can also confirm today that this will not happen. Having an ambitious deposit return scheme that can equitably cover both online and high street sales brings challenges, but I am also confident that industry can deliver solutions to these, particularly given the extra time that they now have. My officials will host a workshop with SEPA and retailers in early 2022 to focus on the details of online take-back. Despite the delay, I can also confirm that producers will be required to meet a 90% collection target by the second year of operation rather than the third, as previously planned. This will ensure that the scheme is maximising its environmental impact from 2024, as before. I, Circularity Scotland and the Scottish Government are keen to support businesses in their planning to make sure that this implementation date happens. Retailers are playing an essential part of the deposit return scheme, as most of us will use their stores to return the containers and receive the deposit back. I know from speaking to them that they are strongly committed to the DRS being a success and that they have already put in a lot of time and resource to prepare for the rollout of the scheme, and this will ramp up in the year ahead. As part of the phased implementation of DRS, a key visible milestone for consumers will be when retailers start rolling out the return infrastructure in stores from summer 2022. We are working together with the retail industry to start phasing in the use of this infrastructure on a voluntary basis from November 2022. We recognise that the needs of rural areas may be different from more populated parts of the country. I am pleased, therefore, to let you know that there will be a return scheme in place in Orkney also in November 2022, which will provide immediate benefits to the community. Regulations asking Parliament to approve the change in go-live date will be laid tomorrow. We will also take this opportunity to make several smaller amendments to the 2020 regulations. In the year and a half since the regulations were passed, many organisations across the private and public sectors have been working hard to consider how DRS can best be implemented, and these have thrown up points where we accept small changes will provide additional clarity or help to de-risk the implementation. I am looking forward to engaging with members across the Chamber as we move into the scrutiny process, but I can confirm that the changes will include allowing online retailers and others selling through a distance sale to refuse to accept a return of a disproportionately large number of containers, clarifying that for products that are filled and sealed in a retail or hospitality setting, for example crowlers, the person filling them will bear the responsibility for their collection. Creating a duty for wholesalers and others selling articles not intended for sale in Scotland to disclose that at the point of sale, which will help prevent fraud. Bringing SEPA's enforcement powers more into line with existing legislation. There are also a number of key milestones on the path to August 2023. By March 2022, Circularity Scotland will have signed contracts with partners to deliver its logistics, operations and IT systems. By August 2022, the public awareness campaign will be launched. In the same month, counting and sorting centres will start to be built. As I've mentioned already, retailers will start rolling out the return infrastructure in earnest from next summer, and we are working with them to start using that infrastructure on a voluntary basis from November 2022. In January 2023, Circularity Scotland and SEPA will begin the process of registering producers. And in July 2023, there will be an end-to-end testing of the DRS container through the whole system. Strong and robust governance structures must be in place to oversee the scheme's implementation, recognising that, with the appointment of Circularity Scotland and the passage of legislation, responsibility for successful delivery is increasingly dependent on the actions of producers and retailers across Scotland. This is a shared endeavour, and my officials will be establishing a system-wide assurance group early next year with all of those involved in delivering the scheme, so that collectively we can monitor delivery and manage risks. Senior executives from the Scottish Government, Circularity Scotland and our environmental public bodies will meet regularly to review progress against milestones and take action where required. I have established a communications and engagement group led by Zero Waste Scotland to ensure that business and the public have the information they need as we progress towards full launch. As with this year's independent review, we will ensure that external expert assurance is provided at key points. I will receive regular updates from these groups and will personally meet regularly with Circularity Scotland to discuss progress. This close oversight, coupled with the public milestones that I have laid out, gives me confidence that all organisations have the right governance arrangements in place to collectively deliver the deposit return scheme on time and in a way that works for the people and businesses of Scotland. It couldn't be clearer that the purpose of deposit return is environmental and not to raise revenues, so it is hugely disappointing that the UK Government are maintaining that VAT does apply. If it is not just about the additional cost this brings, I understand from industry that there are still many details to be ironed out with the Treasury's proposal and that there are specific technical challenges that exist, for example, because the VAT is not applied equally through all parts of the system. This will affect the financial flows between thousands of different actors in the scheme. We will, of course, continue to work constructively with Her Majesty's Treasury, Circularity Scotland and wider industry to ensure a solution is put into place in a way that is workable, effective and efficient for businesses. Between now and August 2023, there is a lot of work to be done and a lot of investment to be made. I will be keeping in close contact with industry on the delivery of the key milestones as different parts of the system roll out their implementation plans. You will see in the documents I've released today that the independent reviewers recognise the cooperation, effort and enthusiasm of all stakeholders working constructively to achieve an effective scheme. I am appealing to everyone in the Chamber today to work with us to make it the best scheme possible for Scotland. Thank you.
Thank you. The Minister will now take questions on the issues raised in her statement, and I intend to allow around 20 minutes for questions, after which time we will move on to the next item of business. And it would be helpful if those members who wish to ask a question were to press the request to speak buttons now. And I call Maurice Gold.
Thank you, Deputy Presiding Officer, and I thank the Minister for advance sight of her statement. But the last update on deposit return is a statement that raises more questions than it answers. We now have yet another launch date, but frankly, how can we take this seriously? Only a month ago, the Minister was refusing to give a launch date after delaying the scheme for a second time. This was despite Circularity Scotland issuing a tender last month with a launch date of summer 2023. The Minister has either lost control of the process or deliberately misled Parliament on the launch date in her previous statement. And this comes as recycling is getting worse. Remember, deposit return is supposed to improve recycling, but the figures out last week showed the recycling rate had dropped for the second year running, and it's now at its lowest point since 2013. If the Minister is serious about launching deposit return, we need straight answers. Unfortunately, today's statement is just the same shambolic process full of excuses. There is no word on the start-up costs or how they're being funded, no word on the secretive tender process, no word on whether return vending machines will even be built in Scotland. And like the previous statement, there is little today to reassure affected businesses. No word on preventing fraud and bottle bank raids, no word on potential restrictions in products, and no word on whether the Minister has even met with affected businesses since her last statement. Businesses and public have already been marched up the hill and back again too many times. So I will ask the Minister straight. Is the Minister prepared to stake her professional reputation as a Government Minister on this new launch date?
Minister.
I thank the member for the question, and I thank the member again for his enthusiasm for the deposit return scheme and his keenness to see it implemented as soon as possible, especially given that the Conservative Party, when the legislation was launched in 2020, in May 2020, argued at that time for a delay due to the COVID pandemic and the unrolling situation. So I would hate to accuse the member of political opportunism and sincerely welcome his change of direction that he doesn't want the deposit return scheme delayed. I am absolutely committed to implementing the deposit return scheme as quickly as practicably possible. The 16th of August date, 2023, is, I consider, to be doable, but still challenging for industry, particularly in light of the ongoing pandemic. But I expect the member to follow our progress and the milestones closely, and I look forward to reporting back on them.
I call Colin Smith.
Thank you, Presiding Officer, and thank you to the Minister for advance sight of her statement. Presiding Officer, August 2023 will be more than 2 years later than the first date proposed by ministers in 2019 for the introduction of a deposit return scheme. It will be 7 years after the First Minister first committed to a scheme for Scotland, and nearly 15 years since Parliament gave ministers the power to introduce such a scheme via the 2009 Climate Change Act. Yet businesses are still not any clearer how the scheme will work, in particular when it comes to cross-border issues, a massive issue for those in my border South Scotland region. If the Government can't even deliver a bottle return scheme when it said it would, what chances do we have of delivering net zero by 2045, or in fact any of our continually missed climate targets? Now, the Government's own impact assessment shows that delays would cost local government £6 million a year, and the additional costs of street cleaning, bin emptying, recycling, centre gate fees. At a time the Green SNP government has just proposed a £344 million real-term cut in council budgets, who does the Minister think will pay the extra bill for the Government's incompetence and delay after delay after delay?
Minister.
As previously, when speaking to the other member, I absolutely welcome the member's enthusiasm for this scheme and his desire to see this scheme implemented as soon as possible. This also represents a change of direction for the Labour Party, who, in the debate in 2020, did share the Conservative Party's concerns that we were rushing the implementation with 2022 in light of the COVID pandemic. So again, I welcome this change of direction from Labour and the support of the quickest possible implementation of the deposit return scheme. The Scotland's deposit return scheme will be implemented by industry, as represented by the scheme administrator, Circularity Scotland. This body represents Scotland's producers and retailers and is a private not-for-profit organisation. Many of these retailers and producers have been particularly badly affected by Brexit and the COVID-19 pandemic. Our independent review concluded that Brexit and COVID-19 have had a material impact on the schedule for delivery of the project. Is the member really suggesting inflicting further financial penalty on Scotland's small breweries, hospitality businesses and convenience stores for delays that are due to Brexit and COVID and that are in no way their fault? These businesses that have already had to cope with so much. I am working with Scotland's producers and retailers to deliver one of the world's most ambitious deposit return schemes as quickly as we possibly can under the circumstances in which we find ourselves.
Stuart McMillan, to be followed by Liam Kerr.
Thank you, Presiding Officer. Can the Minister provide an update on discussions that she has had with Scottish-based engineering businesses who can play their part in supplying the equipment that will be needed for the implementation of the DRS scheme?
Minister.
I thank the member for the question. In line with the principle of producer responsibility, it is for industry, especially Circularity Scotland Limited, to procure the infrastructure that will be needed to run the DRS. It would not be appropriate for me to influence those discussions. However, I would note that we anticipate that the implementation and operation of the deposit return scheme will generate a range of employment opportunities in the extensive infrastructure and logistics required for the scheme. For example, in sorting and bulking centres. But our ambition is also for the recycling of PET plastic that is collected as part of the scheme to be recycled here in Scotland.
Liam Kerr, to be followed by Fergus Ewing.
Thank you, Presiding Officer. We've been told that there will be a producer fee. So will the Minister release the business case containing all costs for calculating the producer fee? And can she confirm the amount producers will be charged?
Minister.
I thank the member for the question. Circularity Scotland is a private, not-for-profit company. It's common in Europe for the DRS scheme administrator to be set up this way, and it is entirely appropriate that a scheme has its producer responsibility at its heart. The scheme administrator, in conjunction with industry, will be deciding on and producing that modelling which generates that fee. It is not for me to decide that. And I will remind the member that in November 2019, the Scottish Conservatives not only welcomed that industry was leading the scheme, but they actually wanted to go further and allow industry to set the deposit, which we have set at 20%.
Fergus Ewing, to be followed by Mercedes Villalba.
Will the Minister meet with me and representatives of the Society of Independent Brewers, representing mostly small craft brewers? Is she aware that their calculations are that the average cost of implementing her scheme will be no less than £20,000, much of it payable 2.5 to 3 months in advance of the start of the scheme, and that they regard her scheme as so complex, diabolically complex, that they are contemplating abandoning selling some of their ranges in Scotland? So, what will she do to prevent her scheme driving these small, excellent Scottish brewery businesses out of their own market?
Minister. I thank the member for his question, and I share his concern with small businesses in Scotland and making sure to support them. It's one of the reasons for the extensive work that we've done to choose what we consider to be an ambitious but workable date for the scheme. It is so important that small businesses are supported during this difficult time. Now, the business case for the deposit return scheme rests on the principle of producer responsibility, that those who produce the waste that is littered on our beaches and in our parks pay their part to make sure that that can be cleaned up and prevented. And that is the primary purpose of the deposit return scheme. I have read and responded to letters from small breweries and the brewing industry, and I'm doing my best I can to support them and support Circularity Scotland to implement this scheme successfully and make sure that Scotland's businesses can thrive.
I call Mercedes Villalba, who is joining us remotely, to be followed by Kenneth Gibson.
Thank you, Deputy Presiding Officer. My colleague Colin Smith has already outlined the significant cost to local government and the environment which will be caused by this delay. Someone has to pay for the cost of this delay. The Minister is aware that this is supposed to be a producer responsibility scheme. So can she tell us what steps the Scottish Government is taking to ensure that it will be producers and not taxpayers and local authorities who will foot the bill for this 13-month delay?
Minister.
I thank the member for this question. I appreciate her bringing this question back. I was unable to answer it the other day. As I said to the other member here, we are still in the middle of the COVID pandemic and we are still dealing with the after effects of Brexit. Those producers and retailers that you're describing, we absolutely do want them to take responsibility, but we also have to be aware that they are struggling in the pandemic and with the Brexit thing. And I don't think it is right to suggest inflicting an additional financial penalty on Scotland's small breweries, hospitality businesses and convenience stores for delays that are due to Brexit and COVID and are in no way the fault of those businesses. We will implement this ambitious scheme as quickly as we practically can, which will reduce the waste and litter on our beaches. What the member is proposing would essentially amount to introducing an extended producer responsibility scheme. This will be rolled out in the UK in the years ahead. At the moment, Scotland doesn't have the powers to roll out an extended producer responsibility scheme on their own, and we are working with the UK Government to do this for the four nations, and we will be working on that going forward.
Kenneth Gibson, to be followed by Liam MacArthur.
Thank you, Presiding Officer. Minister, a major wine distributor in my constituency with more than 50 employees, it would have been over 70 without Brexit, has expressed a number of concerns about the deposit return scheme with, for example, labelling. Different labels will have to be applied for each of the 4 UK home nations, with thousands of lines, meaning a hugely bureaucratic and expensive task, estimated to cost a quarter to a half of company profits in a sector that operates on 3% margins. How will this be overcome, and are discussions ongoing to ensure a 4 nations approach, not least regarding labelling?
Minister.
I thank the member very much for the question. First, I would note that there is no requirement in the regulations for producers to adopt a specific label as a means of preventing fraud. That is a matter for the producers and the scheme administrator to decide based on technical and commercial considerations. A number of existing schemes around the world provide flexibility, for instance by allowing smaller producers not to use a distinct label, but to instead pay a slightly higher contribution toward the running costs of the scheme. I understand Circularity Scotland Limited, as scheme administrator, intends to adopt that model. On the point about a 4 nations approach, we are absolutely open to working with the other UK administrations on ensuring our schemes are compatible. However, this would have to be on the basis of protecting the ambition level of Scotland's DRS. I am very excited that Scotland is going first and will be the first nation in the UK to implement the deposit return scheme. I actually very much hope that the rest of the UK will follow in our footsteps and implement equally ambitious schemes, which would make things smoother to administer throughout the UK.
Liam MacArthur, to be followed by Fiona Hyslop.
Thank you, President Officer. Can I apologise to yourself and the Minister for being slightly late into the chamber? Can I also congratulate the Minister on a laudable effort at dressing up an embarrassing failure as some sort of triumph? She suggests a scheme will be in place in Orkney from November next year. Can she confirm if this will be a scheme covering all of the islands or just the Orkney mainland? And is she confident that all of the outstanding questions that businesses and community groups in my constituency still have will have been answered well before then?
Minister.
I thank the member very much for the question. The implementation in Orkney will be a community scheme that will be in place, I believe, in one town in Orkney, and that will allow people to return a deposit get their deposit and donate that deposit to charity. Not only will that allow the people in Orkney to interact with the scheme and return their bottles, reducing waste and litter in Orkney, it will give us good data on how people interact with the scheme, which will help us implement the scheme going forward.
Fiona Hyslop, to be followed by Mark Ruskell.
Is the Minister aware that the Aldi store in Bathgate in my constituency has already begun a deposit return scheme trial, asking for bottles and cans in exchange for vouchers for the store, and they plan to use the feedback from customers using the service to inform plans as they prepare for the deposit return scheme rollout in Scotland? So can the Minister confirm what support the Scottish Government can offer businesses who want to trial the scheme prior to the Government's official launch date, so that, as well as boosting the local economy earlier, the schemes can start up faster and go further when the time comes?
Minister.
I am delighted that Aldi have started this trial, and from discussions I have had with them myself, I know they are planning more. This outlines the enthusiasm that retailers around Scotland have for this project, and I absolutely welcome their support. As you point out, there is much to learn for the supermarkets from trialling DRS as they prepare for the mass rollout of the infrastructure of the deposit return scheme. There is evidently a great commercial opportunity for retailers to lead the way in promoting recycling and encouraging footfall. But I appreciate too from discussions with retailers that there may be a cost. We are working with retailers to understand how we might support earlier and faster rollout of return schemes in advance of full implementation, including logistical support. From engagement with retailers, a firm, final and deliverable full implementation date is the key prerequisite for that, and today's announcement provides that for them.
Mark Ruskell, to be followed by Dean Lockhart. Mr Ruskell is joining us remotely.
Thanks, Presiding Officer. It's clear that Scotland's DRS scheme will be a game changer, and while I share the Minister's frustration over pandemic and Brexit delays, I welcome that the scope of the scheme remains one of the most ambitious in the world, despite industry pressure to dilute it. That means far more bottles will be recycled, including glass and containers bought online. The Westminster Government is developing a DRS scheme for England, I understand, though it is some years behind. Can the Minister comment on whether this scheme will follow Scotland's lead in terms of its scope?
Minister.
I thank the member very much for the question. The scope of the English scheme will be a matter for the UK Government to decide. However, Scotland will be the first country in the UK to have a deposit return scheme, and I hope that our level of ambition will inspire the other governments to follow suit. And don't forget that the scope of the scheme that we are introducing here is ambitious relative to many of the DRS schemes elsewhere that we often hear about. Latvia and Lithuania's schemes, for example, include many exemptions. Our DRS will be amongst the most environmentally ambitious and accessible in Europe, and the inclusion of glass, which will deliver significant environmental benefits and reduce litter, is a key part of that.
Dean Lockhart, to be followed by Claire Adamson.
Thank you, Presiding Officer. Last week at the Net Zero Committee, Jim Fox of Food and Drink Scotland told the committee that some parts of the industry are ready to go, but other parts of industry are not. Now, given the time delay, I assume the Minister has done a lot of analysis in this area. Can she therefore tell us what percentage of industry is not ready, and what are the subsectors of the industry that are not ready for DRS?
Minister.
I thank the member for the question. The question is more about what big retailers versus the small businesses are prepared. I don't have the specific numbers for the member and can write to the member with those. The point, I think, is, and the member may be referring to quotes from Coca-Cola, which were made in 2019, before the impacts of the pandemic were known. Big players have sufficient resources to implement their part of the system on a shorter period of time. But we do also need to think about the small producers, convenience stores and hospitality businesses who have suffered so much in the last 18 months. It is essential that the whole scheme is a success and we bring along all the necessary businesses, not just in the short term, but for decades to come. And that's why I maintain that the 16th of August 2023 is a workable but ambitious date for Scotland's deposit return scheme.
Claire Adamson, who is joining us remotely, to be followed by Craig Hoy, who I will squeeze in if he is very brief. Claire Adamson.
Thank you, Presiding Officer. Minister, I was lucky enough to be at Glencairn Primary in Motherwell when the Deposit Return Scheme consultation was launched by the Minister in 2018. The pupils on that day were showing their collective work in reducing plastic waste and eliminating single-use plastic in their school. As some of them will now be teenagers at the launch date, what is the Scottish Government doing to engage young people and encourage their continued support and participation in the circular economy?
Minister.
I thank the member very much for her question. I was lucky enough to meet with some school children during COP who talked about wanting to implement their own deposit return scheme at their school. So I challenged them to a race. If they can get theirs in before mine, I would come and congratulate them in doing so. I absolutely agree that engaging with young people will be essential. Indeed, we know from other international schemes, such as the one in Sweden, that there is a link between reaching out to young people and the overall success of the scheme. The approach will be developed as part of the public awareness-raising campaign and will be informed by Zero Waste Scotland's research about the attitudes of younger people to DRS and the best channels to reach them with the information. As I mentioned earlier, the public awareness campaign, will be launched in August 2022, 1 year before the full implementation.
And Craig Coy, briefly, please.
Thank you, Deputy Presiding Officer. Given that the necessary funding is still not in place and that Circularity Scotland lacks a full board, doesn't have a permanent CEO nor a permanent CFO, can the Minister say on what date, what day and which week and which month she decided to delay the scheme?
Minister. Sorry, can the member repeat the question? I wasn't sure how it linked up with what he said before.
Excuse me, I think, Minister, it would be for me to direct this. Thank you. But, Mr Hoy, in the circumstances, could you please repeat your question?
For brevity, could the Minister tell Parliament on what day of which week and which month she decided to delay the scheme?
Minister.
Sorry, I'm not quite clear on the question. We've been working for many weeks on figuring out how to implement this scheme on the quickest possible schedule. We knew from the Gateway Review, which was a third-party independent review, that they felt, as I've said in my statement, that July 2022 was not a feasible date, and that they suggested that July to September 2023 would be more feasible. And in the time since, we've been doing the groundwork to see what the most feasible date would be, and I have announced that today as the 16th of August 2023.
Thank you, Minister, and that concludes the statement, and there will be a short pause before we move on to the next item of business. Thank you.
The next item of business is consideration of Business Motion 2562 in the name of George Adam on behalf of the Parliamentary Bureau on changes to business this week. Any member who wishes to speak against the motion should press their request to speak button now. I call on George Adam to move the motion.
Thank you, Presiding Officer. And moved.
Thank you, Minister. No member has asked to speak against the motion. Therefore, the question is that motion 2562 be agreed. Are we all agreed? Yes. The motion is therefore agreed. There are no questions to be put as a result of today's business. That concludes decision time. And it's now time to move on to the next item of business, which is members' business.
Okay, the final item of business is a members' business debate on motion 2093 in the name of Jenny Minto on importance of community defibrillators. This debate will be concluded without any questions being put. Would those members who wish to contribute to the debate please press the request to speak buttons now as soon as possible. Place an R in the chat function. And I call on Jenny Minto to open the debate for around 7 minutes. Ms Minto.
Okay. Thank you, Presiding Officer. My dear friend Carl Reevy died of an out-of-hospital cardiac arrest in January 2018. He was...
What distinguishes Broadcasting Scotland from a website or blog, apart from our brilliant programmes?
Hi there, I'm Gordon Ross.
Are the costs we face to enable us to produce those programmes. These costs are significant and ongoing. However, our facilities are able to do so much more if only we had the staff. In the last year, some of our supporters have cancelled their subscriptions. In one way, we would prefer it if it was because they didn't like us, rather than it being because of the financial pressures which we are all under because of COVID. The really positive outcome of our fundraiser is that at a time of economic challenge in Scotland, we will use your donations to create jobs and in a small way contribute to improving the Scottish economy. If you want us to be Scotland's independent broadcaster, able to provide an alternative mainstream television platform, then please support us.
Scotland is going to be an independent country.
Just imagine what we could do if we had even 1% of the BBC Scotland channel's budget. Imagine. And then please consider turning your imagination into reality. Please support us if you can afford it.